to press.
Good morning, honourable members. It is so good to see you all this morning. Bright and early, I realized that the Honorable Mnyai thought the meeting was on Zoom, so he's on his way because of that. But good morning, all of us. Good morning to the CDA. Thank you for honoring the invitation to come through with your teams, but we are glad you are here. I see that we have the Honorable Deputy Minister with us today. Greetings again, Honorable Deputy Minister and your team from the department. We do have a acting DG today. So as long as the work continues, I believe it does not, it is good that we do have someone in that seat, because we will need to have some guidance in some issues. But before we start, I would ask us to please take just 1 minute for silent prayer or meditation. Thank you so much. I should have said that while we are praying, we should also, remember the soldiers of this country that lost their lives in the DRC. But good morning. I would like to hand over to Sis Lindy right now to take us through the procedure of the day. Thanks.
Thank you very much, Chairperson, Deputy Minister, and the members of the committee, CDA and departmental officials, and any other stakeholders in attendance. Chair, my role is very minimal, is to take the committee through the agenda of today, the 12th of February, Chair. You have welcomed us briefly, and then after that, Chair, it will be important for the members to introduce themselves, since it's our first time to meet with CDA, and also CDA officials to introduce themselves to the committee. Chair will adopt the agenda. There's only one apology thus far from the Minister, who is unable to attend today's meeting due to a cabinet meeting scheduled at the same time. But she has conferred her powers to the Deputy Minister to lead the delegation in today's meeting, Chair. And then we'll get an overview from the DM, and then we'll proceed to receive a presentation from CDA for 45 minutes, and then we'll have deliberations from 10:15 to 11:15. Chair, there is a presentation from DSD to present the IMST, to present the system to track social grant beneficiaries who wrote and passed matric in 2024 and impact thereof, Chair. There is a presentation, the Word and the PowerPoint presentation, and also it's important to note that they can do a live stream if you wanted to see the system. So they can demonstrate it live, Chair, just to see the results. If you want a particular province, they can do that for us. And then we'll deliberate from 12:15 to 1:45 on the presentation, and then we'll proceed with the internal business to adopt the minutes of the 29th, and then also to present the resolution tracking mechanism for January till March. And therefore, Chair, at 1:55, you will make your closing remarks and the meeting will adjourn. Chair, we are a quorum. We are in compliance with rules of the National Assembly, Rule 162, and then we can take decision in this meeting. Thank you, Chair. Over to you.
Thank you so much. We are halfway through getting our license to hold this meeting. I just need to ask the honorable members to please adopt the Honorable Abrams.
Thank you, Chairperson. And the reason I rose my hand so eagerly to adopt the agenda is because I'd like to adopt it with an amendment, please, Chair. And the amendment being that because we do have SASSA here, and unfortunately the Minister is not here, but the DM is here, there is a crisis currently unfolding across the country when it comes to SASSA, and that is the card renewal process that have people standing in snaking long queues that Postbank is currently undertaking, and it's just been a complete nightmare for many SASSA clients. So, Chairperson, I do hope that within this agenda, we can leave time for the DM and for SASSA and for the members to please engage in this point that's really taken many people, particularly seniors, they are facing fear and anxiety and panic over not receiving the social grant come March. Thank you, Chairperson. And with that, I will move for the adoption. Thank you, Chair.
Thank you for that. I was going to actually address the Honourable DM before he does his overview, because I do also feel that we do need to hear, just not because it hasn't been prepared, because this meeting was not about that, but just to get some undertaking from the side of the department through SASSA what is going to happen, because the situation on the ground is not sounding good. I have not gone on a physical oversight, so I don't have, evidence to that effect. I have pictures though, but I haven't been there physically myself. But the only province I have not received anything from is the province of the Northern Cape. But every other province I've just been having calls every hour and any hour of the day. So we would like to hear some sort of thing in this regard. So I just would like to know if the other colleagues are okay with their amendment to the agenda. It's a very minor amendment, but it's a very crucial amendment. So any seconder to this formal secondment of the agenda? Oh, okay. The Honourable James. The Honourable James has seconded the, yeah. Okay.
Sorry, Chair, I forgot to mention two apologies. That Mr. Member Munyai is running late. He will join the meeting a bit late. And also, Chair, the 3 members from the Konto Wesizwe Party, they would want to be excused just for a few minutes at 10 o'clock. They have a briefing to attend to. They will come back immediately when they are done with their briefing. Those are the 2 apologies I want to tender. Thank you very much, Chair.
Thank you for that. I think we are set with those adoptions, with the amendment that I'm confident the Honourable DM will take care of. I will just hand over to you. Oh, sorry. We need to do introductions. Sorry about that. I would like to start with the members, just for the benefit of the CDA, obviously, but also for other stakeholders who may be here for the first time this year or whatever other reason, for them to know who the members of this committee are. My name is Bridget Masango, and I have the honor of chairing this portfolio committee. And we'll go over to you, Honourable Mhlongo.
Thank you very much, Chair, and greetings, everyone. My name is Tembile Mhlongo, a member of this portfolio committee. Thank you.
Good morning, Chair. Good morning to the DM. Good morning to our guests from the CDA. It's always awesome seeing you. I'm Dirlene James.
Well, thank you very much, Chairperson. I am Paulina Mahato, member of this portfolio committee. Thank you very much.
Thank you so much, Chair. Greeting to everyone, Deputy Minister, members. I am Reverend Nhlanhla Gwaza Mkhonto Gwabaza.
Good morning, Chair and everybody. I am Honorable Nowethemba Mtsweni. Thank you.
Morning, Chair, and greetings to the DM, my colleagues and officials from department. My name is Kiamutsin Stein Ramaila from the African National Congress. Thank you.
Good morning, Chairperson, and good morning to the DM and to all other protocol observed. My name is Alexandra Abrams. Thank you.
Morning, Chairperson, Deputy Minister, and all staff members, colleagues. My name is Paulita Marais. Thank you.
Good morning, DM, morning, Chair, morning, the members, and also the staff of that committee. My name is Noluvuyo Tafeni from Economic Freedom Fighters. Thank you.
Assalamu alaikum. Good morning, everyone. My name is Ratika Tahudin.
Okay, we are done with the members. Yeah. Oh, okay, we can come over to the CDA then and the department.
Good morning, Chair, Honorable Chair and Honorable members. My name is Nandimaya Tulakoza. I'm the Chairperson of the Central Drug Authority. Thank you.
Good morning, Chair. Good morning, DM and members of the committee. I am Nomcebo Dlamini, the Deputy Chairperson of the Central Drug Authority.
Good morning, Chairperson, and good morning to the members of the committee and also to the DM and my colleagues. My name is Lumka Oliphant. I'm the Acting DDG Corporate Support Services. Thank you.
Good morning, Chair and honorable members. My name is Jacques van Zuidam. This week I'm the Acting DG. Acting DG. Last week and next week I've been the Acting DDG for Strategy. But usually I'm the Chief Director of the National Population Unit.
Okay. Morning. My name is Athalia Shabangu from the Directorate Substance Abuse and CDA within the department, and I'm a CDA Secretariat. Thank you.
Good morning, Chair. Good morning, DM and the House at large. Thank you. My name is Nundumiso Kwai, Special Advisor to the Minister.
Morning, Chair. Morning, DM and the House at large. My name is Osborne Nongunga. I'm the manager for the Data Warehousing and Business Intelligence Unit within the Department of Social Development. Thank you, Chair.
Good morning, Chairperson. Good morning, Minister and the colleagues at large. My name is Michael Machubeng. I'm the Acting CIO, DSD. Thanks.
Good morning, Chair and Deputy Minister and the House at large. My name is Onati Ngumla. I'm the Portfolio Manager for the Integrated Justice System within the Department of Social Development. Thank you.
Good morning, DM. Good morning, Chair. Morning, honourable members and colleagues. I'm Des Jason. I'm responsible for monitoring and evaluation at the Department of DSD. Thanks.
Good morning, DM. Morning, Chair. Morning, members and colleagues. My name is the other Osborne Masilela. I'm the Chief Director in the Office of the DG, the proper Osborne with an E.
Good morning, Chair. Good morning, DM and the House at large. I'm Wisani Kosa from the Department of Social Development within the Directorate Substance Abuse and CDA, and I am a CDA Secretariat. Thank you.
Sanbonant, Deputy Minister, Honorable Chairperson, Honorable Members, Acting DG, and for this week and the rest of the colleagues, I am Tabani Butelis from the National Development Agency. Thank you.
Good morning, Chair. Good morning, the Deputy Minister and DSD officials. My name is Khomotso Kekai in the Office of the DG. Thank you.
Good morning, Chair. Good morning, TM. Good morning, honorable members. Good morning, colleagues. My name is Wendy Masibi from the Office of the Director General. Thank you.
Good morning, Chair, Deputy Minister, honorable members, colleagues. I am Zodwa Mvulane. I am working for an institution called SASA.
Good morning, Honorable Chairperson. Good morning, honorable members and colleagues. My name is Raphahle Ramokgopa. I'm the Executive Manager for Strategy at SASA, but today I'm acting for the CEO who is currently in a conference outside the country.
Good morning, Chair, honourable members. My name is Colleen Ryan. I'm with PMG Monitoring.
Good morning, Chair, and good morning, DM and colleagues. My name is Mohammed Harun. I'm the HOO of the DM.
Good morning, Chair. Good morning, members and everybody. My name is Nehla Chwayo. I am from MK support staff. Thank you.
Good morning, Chair. Good morning, TM. Good morning to all government officials. My name is Luvuyo Shasha, a parliamentary liaison officer in the Office of the Minister. Thank you.
Are you advising who? Oh, okay, sure.
Yes, Assalamu alaikum. Good morning, Deputy Minister, Chair, and everyone present. My name is Aisha Ali Patel, and I'm the PLO for the Deputy Minister. Thank you.
Good morning, Chair. Good morning, members. All protocol observed. I am Vuyokazi Gwam, ANC caucus researcher. Thank you.
Good morning, Chair and honorable members. My name is Faith Ndenze. I'm Communications Media Officer for the committee.
Good morning, good morning, honorable members and Chair. My name is Siavia Kudula. I'm the researcher for the committee.
Good morning, honorable members, and good morning, our guests. My name is Thandi Makhubelela, the secretary to the chairperson.
Good morning, Chair, members, DM and officials in attendance. My name is Lindy Wensabo. I'm the committee secretary of this committee. Thank you very much.
Morning, Chairperson, morning, Deputy Minister and members and colleagues. My name is Yolisa Kanye. I'm the content advisor for the committee. Thank you.
Thank you so much. Now we all know who is who. This is why I insisted to know who the gentleman was advising, so that we know who to talk to when we need what information. We now are in a position to start with our meeting in earnest, and I'm going to hand over to the Honourable Deputy Minister, please.
Chair, you must guide me. Do you want me to address the SASA issue, or must we follow the agenda as we have it? And is that a matter that we're going to handle now or at the end?
Honourable Deputy Minister, that is an issue we are handing over in your hands, and you can deal with it in a way that you have planned, or you have been able to plan within this short space of time when we addressed it to you. Whether you want someone to talk to it after you will have after they've heard what it is that we would like to hear, and then maybe at the end they can come in. But I leave it entirely in your capable hands. Thanks.
Thank you very much, Honourable Chair. It is a matter of urgency, and let us, get into it directly. I don't want that matter to be on the top of mind of honourable members. We want them to focus on the good work that is being done by the Central Drug Authority and the challenges that we have now that their term is going to come to an end in the next 8 months. So with regard to the queue management and the long queues, Honourable Chair, when there were issues raised about a National Command Centre for Gender-Based Violence, I was advised by one of the chief whips, you're putting your foot into it, but I had a meeting with Vodacom, the funders of that, and in fact, I made a mistake by saying I'm having dinner. You don't have dinner with these people. But I had, and I'm happy to say that progress has been made to operationalize the National Command Centre. So when the matters relating to long queues came to my attention, in my first week as Deputy Minister, I sat down the CEO and the leadership in Cape Town, and I told them it's unacceptable. I joined the queue at 4 o'clock in the morning, and I saw old ladies with buckets in their hands, and I asked them, what you are doing with these buckets? And they said, the toilets are closed. If we have to relieve ourselves, we stand around one another, and then I have to relieve myself. And that's why I had that emergency meeting with the CEO of SASSA and her staff. So in Cape Town, we started a process of online applications. And I managed to get SASSA to agree that all councillors of all political parties must take the lead in assisting their constituency with online applications. And SASSA, I thought, let me start with my own party, and I gave an order to one of my councillors, and I told him to do the pilot. So far, they've done about 500 online applications. They've been trained by SASSA. Whenever they call SASSA Cape Town, they are there to provide support. And it is working very well. Some of these people who do online applications, they already receive their SASSA payments. So it is working very well. It's a seamless system. And in fact, I would like to use this opportunity to call on all political parties in Parliament especially to start in their parliamentary constituency offices, provide this particular service. Now the reason we are sticking to councillors only is because they've signed the necessary oaths and they can be held accountable. We don't want people to make a business out of this. So it's a service that has to be provided. In fact, this weekend in Pinelands, I've directed that my councillors be present at one of the biggest trade fairs, community trade fairs, just before Ramadan, to assist people to do online applications. And I understand SASSA will also be around to assist. I'm pleased to say that we are well aware of these problems, and I believe that SASSA is on top of it, but let them speak for themselves. So acting DG, I'll leave it to you to get the SASSA representatives here to give us a peace of mind that we need so we can focus on the two important agendas of the day.
Honourable Minister, Deputy Minister, thank you so much for that assurance. I would also like them to, in that what the SASSA person will do, to talk about the swapping of cards, because that is what is the problem at the moment. It's a huge problem. As I was saying, there is an infographic of SASSA that is going around that says, dial this number, and then when you dial this, up will come all manner of places where you can get your card. People have gone to all those places and there are no cards. So if SASSA can also bring us up to speed about how this is going to happen, especially given the deadline that is looming, because we cannot afford, as this portfolio committee, to have another SASSA crisis on our hands. Please, thanks.
Thank you very much, Madam Chair, and thank you very much, Deputy Minister. Indeed, the matter is on the highest priority in the department, including in the Deputy Minister as well as the Minister's radar. Of course, we've not been pre-warned or pre-alerted to do a presentation on the issue, and therefore we've not become prepared on that. But we do know that the leadership of SASSA and particularly the acting CEO of SASSA, Ms. Raphahle Ramagopa, she's with us in the meeting, and she is in a position to give a feedback. But I think the understanding has to be, of course, that there's not been time to properly prepare. We quickly spoke to each other. We are able to ask SASSA to convey what SASSA can convey. And of course, you know, should the committee want a proper briefing very soon, we will convey that to the Minister and make sure that such a more organized and systematic briefing takes place as quickly as possible. So let me hand over to Ms. Ramagopa. Thank you, Chair.
Members, we have a situation in terms of card replacement. We have over just above 3 million beneficiaries who are using the Postbank card, and so far the card swap process, since it started, we have swapped just about 1 million grant beneficiaries have been swapped, and somehow we are still in the process of swapping. What we have done is that after noticing that the queues were long, we are increasing the sites in terms of the card swap. So we are working with Postbank so that we can have more sites where we do the card swap. We've also noted that in some areas or in some of the ShopRite and Boxers, you'll find that there's few people who are doing the card swap. You'll find that there's 2. So we are increasing the number of staff that we are going to put in, especially in the metros where we have long queues. So we are working on that. We have also asked Postbank to train some of the SASSA staff in order to help in the process, because they are not banking people. SASSA staff are not banking people, so they have not been trained on the card issuance. So we are training them this week. So we are hoping that by next week we'll have deployed. But other than that, we are also negotiating an extension. We cannot confirm it yet, and once it's given, we will come back and issue a report. I'm requesting that should I give a written report by Friday to the committee members, just to explain the detail of what is happening across the country. But what I can assure you is that we are aware of the problem and we are working on it. Thank you.
Thank you so much for that. Is that a hand, Honourable Murray? Okay.
Chairperson, the concern that I have, I know that SASSA was not prepared to come here. My concern that I'm having is that these Boxer stores and ShopRites, it is happening in town, it's not where the community are. I live in Pelican Park. I went to ShopRite in Pelican Park. on Saturday, and the people were standing there confused. Even the ShopRite people there doesn't even know what they are talking about. So they give you the letter to say it's going to be at ShopRites and Boxer and wherever. They don't say which ShopRites. So people go there and the ShopRite staff is confused. They don't know what's going on. And the problem that we are having is that the gold card was supposed to be implemented last year, December. Yeah, before that even. My problem is now they come with a bang. It must be finished by the end of February. And even SASSA themselves is not like the lady was just saying now, the acting, is that their people cannot work with the cards. And they know that Postbank doesn't have the capacity to do that, millions of cards immediately. And this is going over all the provinces. People are calling us, people are sending us emails, sending us WhatsApp. It's a madness. So I don't think the people realize sitting here the magnitude of what the people are asking from us, because not having a SASSA pension for 1 month is a disaster for these people, because they rely on those SASSA money. So by them just saying the end of February without communicating with the communities and just bring out the thing and say it must be done by the end of February, people are in a panic. What about the old people that doesn't know online cannot be done for cards? It's for ordinary applications, but not for cards. Cards, you must go in there to the banks and to the offices. And the worst part, people were telling me that, look here, I went last year October. I even have this thing on my WhatsApp here. I went last year October to SASSA's office because I went to Capitec because I didn't want to go for the new card. I gave them my bank details and everything. I've been to SASSA's office again last week. They still didn't put me on the Capitec Bank. So SASSA is also not doing what they're supposed to do. When people heard about these things, to go and change their things, they didn't do that. Now people are in a panic. And when it comes to money, it's another thing. And our old people don't understand all these terms that we are using. So I just want SASSA to come out, because next week is too late. Because then it's the 20th already, the 22nd. And then there's only 8 days over for this thing to be done. And 8 days is not enough for all that 6 million people. So we need to come up with a strategy how we're going to do this thing and how it's going to be done by the 28th. And if it must be extension, they must notify people in time so people can know, because now people are upset, people are running like mad, people around. Thank you, Chairperson.
Thank you, Honourable Murray. Honourable James.
Thank you so much, Chairperson. I too have received quite a few phone calls this morning. Also, I received a message from Elizabeth Reiters, and Elizabeth Reiters is an advocate for Pay the Grant. I also saw that she was interviewed last night, and she's been in quite a few interviews, and she sends me this message this morning. SASSA is oblivious to the human suffering on the ground by them creating all these barriers for the most vulnerable to access their grants, knowing more than 18 million depend on the grant system to survive. I urge the department to set up a meeting with us so that we can inform them of all the struggles in the communities. She further goes on to say, also, EKYC system, now this is the system that I think they use for verification, has been down for more than a month, yet SASSA is still blocking thousands of beneficiaries and they can't unblock themselves. This has been stretching since last June. How must these beneficiaries survive depending on the SRD? She also further explained to me, Chair, that there are old people who requires home visits to do this changeover. When is that going to happen? I think this is another emergency waiting to blow up. I don't think that we can afford to wait up until next week to remedy the situation. People are panicking. She also further goes to explain that people have been to these retailers, and considering that we are dealing with the most vulnerable, they don't have money. They have been up and down into the retailers twice, thrice, having to borrow money to get to retailers to do this. So somehow we need to come up with a more seamless exercise. Also, when they do get there, some of them are being turned away, the long queues, it is just chaos out there. I think we need to treat this as an emergency, because people are set, as things stand now, there's a great possibility, and we know this is going to happen, that millions are going to go hungry. Let us not wait until next week. Minister, let's give this a 24-hour turnaround to come back and say what is going to be done to address this national crisis. Thank you.
Thank you, Honourable James. I will recognize Honourable Ramaila, Honourable Mahatu, Honourable Abrams, Honourable Mhlongo. in that order, please. Thanks.
Thank you, Chair. Quick calculation says it's about 33% success. It's not impressive. And I might say, DM, we can't afford to always be put on a crisis mode. Can't afford it. We definitely can't afford it. You've got employees who are specialists in certain fields. You've got planners. You've got a monitoring and evaluation department. That should keep us posted at all time. And monitoring and evaluation is there to ensure that it picks up the risk quicker so that they can find a way to really deal with those risks. And so far, it's not fair for us. Had it not been that there's been a request from the honourable member here for us to be briefed about the success of this swapping of cards and so on, wouldn't have had a briefing. The department never saw or deemed it fit to brief us about how far the process is. Most definitely, we are heading for a crisis. We must all admit, we are heading for a crisis. Chair, how long are we to continue operating in this manner? Are we taken serious as a portfolio committee? We need to be told that at some point. This is quite unacceptable. We're not even certain whether the extension is going to be there. I agree with Honorable James. This is a crisis. This is a matter that requires an urgent attention to. I think it's a matter that needs to be escalated DM to the minister as well. That within 24 hours, it must be communicated to the chair as to how are you going to remedy the situation. And when are you going to start taking serious the people of this country, particularly the vulnerable? There is within them those that are ill in hospitals, at home, and so forth. We don't know how those people are going to get assisted. Yes, constituency officers might be used, but they also need to be trained to be able to do that. Given the deadline that we have now, this is going to be a mission impossible to achieve. Thank you, Chair.
Thank you, Honourable Ramaila. Honourable Makhat.
Thank you very much, Chairperson. I just want to thank for the report. But really, we are not happy as the social portfolio department. So they spoke about the 3 million cards. But if you still hearing what they are explaining, you can hear that no, things are not fine. So working with the post banks, SASSA must go down and work at their responsibility. We are not happy. And with the attitude, please improve as early as possible. I think from today, try to improve as early as possible. And again, according to the briefing, things are not fine. And the Deputy Minister, please assist them as early as possible so that they can approve on the matter. So the matter is serious now and is long overdue. Thank you very much.
Thank you, Honourable Makhatu. Was it Honourable Abrams? Sorry.
Thank you, Chairperson, and thank you, DM, and to SASSA for that brief presentation. I do think it's important. I mean, you have the strategies, the planners. The situation could have been preempted. the fact that this is our first in-person meeting, you can also preempt us. You must have known that we were going to come here and ask about this, because we've been getting phone calls since the 1st of February on this matter. So there is a degree of to preempt situations, which I feel is lacking. Also, this is not the new card renewal crisis that we are finding ourselves in. We had the same type of crisis last term, and it seems that we have not learnt from that crisis. So there's been no improvement from one crisis to the next crisis. For example, within the Western Cape, because I represent the Western Cape, there are only 12 sites where people can go and collect their card renewals. The whole of the West region, there's no place for the West region to go and collect their cards. That's number one. So increase of sites is welcome, but how many more sites are going to be open? I think that's information we also need to know. Then also, there needs to be, there's been a call, Deputy Ministers, for SASSA to please come back out to communities. It's a call that the public has been making for a long time, and I do hope that you can please look into that SASSA please come back out to the communities and to use the community halls. Then also we do need contact details and email addresses of who we can refer SASSA clients to who are bedridden, that will need Postbank to come out to them. So if we can please get that contact details, before Friday, so that we can also start channeling that information down. Then, Chairperson, many of the individuals, to avoid having to deal with this incompetence of Postbank and SASSA and being in queues, they have chosen to move over to the bank account of their choice because it is more reliable. We've sat in meetings with SASSA. We were told that that is actually encouraged, that we should encourage people to use bank accounts. The banks have their own verification systems, etc. But then I'm told that SASSA is sitting with backlogs and they haven't been able to capture all those people onto their bank accounts, and that those same people who are trying to get away from the system are being sent back to go and collect a black card. So now you have people wanting to alleviate the strain on government by moving over to the banks, but then SASSA's not coming to the party in capturing those forms. And I do think there needs to be a commitment, DM, that everybody that has now applied to move over to a bank account, that you must increase the staffing capacity to capture those people before the deadline. And then my last point, Chairperson and DM, from where I'm sitting, the negotiation on the extension of the deadline, that negotiation needs to be very crystal clear that you can't stop people's grants. It would be unconstitutional. Both ministers will find themselves in front of court once again for stopping people's grant. The only time that you can stop the gold cards is once absolutely every one of your beneficiaries have got a black card in hand, or they have moved over to the bank account of their choice. So negotiations, fantastic, but the bottom line is you can't stop the grant until everybody has been successfully moved over. And I think the quicker that you can get that message out to the poor people who are in devastating situations at the moment, the better, because you're making people's blood pressure rise. You're going to be the cause of people collapsing in these long queues. So the quicker we can get that confirmation of that extension, and you get that message out to us to help you channel that that communication out through all of our structures and networks, I think the better for absolutely everybody. Thank you, Chairperson.
Thank you, Honourable Abrams. You are welcome, Honourable Mnyai. We did get your apology, and so you are welcome to the meeting. Honourable Mhlongo.
Thank you very much, Chair. Chair, I think members have covered me, but then I don't think SASSA really takes the people of South Africa serious, because we were at some point with the green cards and moved to the gold cards. And the very same problem was there. We're now moving from gold to black. The very same problem was there. They now speak of training SASSA people to assist because they're not working in the banks. Why were they not trained before when we were migrating from that green Mpilweni card to the gold card? Clearly, SASSA does not take people serious, because if indeed they did, they would have looked at the loopholes of the first transaction and then correct them in this one. So I do not really think SASSA takes people serious. Now they speak of an online application, which I do not think online things would work for SASSA beneficiaries. It's old people, network issues, data issues, that's not there. And Chair, we can't say we'll look into the issue of an extension. As a portfolio committee, we are saying it must be extended, because looking into an extension is not going to help. Like I saw the communique today of the cards. I was not even aware. I went on Twitter, I saw it. It's starting to trend these days because the closing date is nearer. But had it trended in December and January, people were going to be aware, but it was not there. It's only surfacing now because the closing date is nearer. So I would plead, Chair, that as a portfolio committee, we request SASSA to extend, not for them to go and look into the matter of extension, because them looking into the matter of extension clearly would not help. They must just extend, because there's no time. They did not give people enough time. Thanks, Chair.
Thank you so much, honourable members. I think the message is loud and clear, and I am very confident that the Honourable Deputy Minister and the team and the leadership of SASSA are hearing exactly what the members are saying. And what you are hearing the members saying is a direct reflection of what is going on the ground. It is not a good thing that one is hearing. People with dementia having to stand in queues, and families being scared of this, and it's just is a clear indication that there was no pre-rollout planning that took place. So let us catch up, please. I'm saying this to the department and to SASSA, so that we avoid, and I want to concur with every single comment that has been made by the members, up to and including the fact that we cannot sit here on the 12th of February with the situation on the ground as it is and be talking negotiations. That is not, and it can't be an issue. I know that there are issues about South African Reserve Bank having to agree, but I also know that there are 3 million people that need their money, that live on that money. So let's just make sure that whatever it is that needs to be done, and please take note of each and every comment that has been made, and let us just make good to that. I do need to take this opportunity to profusely apologize to the Central Drug Authority for having hijacked your meeting. You will be getting the time that you need to do justice to your presentation, and the deliberations will take place as well. And also to the department on the IMST presentation, we will make sure that you are covered on all those issues, because we just needed to take care of the situation that we find ourselves in. And some of us, this is not the first time we find ourselves in this situation, so it is nuanced in a way. So I would like to then hand over to the acting DG to direct the process of the presentation. Thank you so much.
Thank you very much, Madam Chair. And also thank you very much, members, for the inputs and advice on the previous discussion. Certainly the department and SASSA will very seriously attend to that. Yes, Madam Chair, so we are joined by the chairperson of the Central Drug Authority, as well as the chairperson is Ms. Nandi Mayatula Koza, as well as the deputy chairperson, Ms. Nomtebo Dlamini. So the CDA has prepared the annual report and they finalized it, and they will be presenting it. The secretariat of the CDA, which is hosted in the Department of Social Development, is represented in the meeting as well. Ms. Atalia Shabangu to the left of the Deputy Minister. Of course, you know, so the department is ready to engage as well, but we assume the primary engagement would be the report by the CDA itself to the Portfolio Committee. Thank you very much, Madam Chair, and I'm handing over to the Chair. Thanks.
Thank you very much, AADG. Honorable Chair, honorable members, Deputy Minister of Social Development.
My sincere. Oh, this meeting is just turning out to have a life of its own. Because we hijacked the Deputy Minister to give us this briefing on SASSA, I completely took away his time to give us his overview. My sincere apology. It would be proper that the Deputy Minister gives his overview and then you can come through. And after that, I'm not going to say a word. After the Minister speaks, you take over CDA. Thank you so much. Thanks, Acting DG, for the reminder.
Thank you very much, Chair. Honourable Chair and members of the Portfolio Committee on Social Development, the DSD Executive and the Chair of the Central Drug Authority, Ms. Koza, and members of the CDA, and also members of SASSA who are in the hot seat. Ladies and gentlemen, good morning. Honourable Chairperson, I'm pleased to lead the DSD team and the members of the Central Drug Authority present here today. This is an area of work that has been close to my adult life and many of you as activists. For the past 50 years, I must have been in 50 marches with regard to the challenges around drugs. Many of my friends were jailed, were killed. So this is a 50-year problem as far as I'm concerned. For the scourge of substance and drug abuse is a challenge for South Africa and the world. South Africans spend 7.7 billion on alcohol between the 25th of December and the 1st of January this year. If we introduce the COVID regulations, that 7.7 billion could have been used to buy food. According to the South African Society of Psychiatrists, almost 20% of South Africans, 1 out of every 5 adults, abuse mind-altering substances like alcohol, painkillers, dagga being the worst offenders, and rising figures of illicit drug use suggest the country is losing the war on drugs. We won the war against apartheid, but we seem to have lost the war on drugs. And that's why I know of many activists, after we got our freedom, that realized that drugs is the next challenge, and they have been in the front line of trying to deal with the challenges around drugs. And I just hope that the fourth 5-year drug master plan will also make contact with these activists who were in the trenches but are ignored when it comes to the fight against drugs and associated with gangsterism. The annual cost to the country of alcohol abuse alone in terms of absenteeism, lost productivity, health and welfare costs, and alcohol-related crime is estimated at up to 10% of the gross domestic product, or as much as 37.9 billion annually, according to a 2014 study in the South African Medical Journal. You can imagine how much it costs the country today, especially its causal relations to gender-based violence and femicide and all the social ills. Thank you for the opportunity afforded to the Central Drug Authority to present the 2023-2024 annual report for consideration by the Folio Committee on Social Development. They have about 8 months left before their term of office ends. So your responses today, honourable members, will help them complete the race. I want to say that the third drug master plan is now being evaluated by an external service provider. Before that, the government themselves evaluated the success, and their report will be ready the end of March. I would like to request very humbly that the Portfolio Committee unpack the progress report of the third 5-year drug master plan, so when we prepare the fourth 5-year drug master plan, that it addresses all the concerns and needs of the constituencies of honourable members. The CDA report will highlight some of the continued and sustained milestones during the sixth administration, particularly in terms of the investments made by national departments, public entities, provinces, provincial substance abuse forums, and local drug action committees in people through their various interventions to address and counter the drug problem in our country. As we are all aware, South Africa, like other countries, is adversely affected by substance use and substance use disorders, alcohol being the most widely used psychoactive substance in the country. That's why our minister, when she went to Sweetwaters near Pietermaritzburg on No Alcohol Day, she said, look, I'm not going to ask you not to drink alcohol today. I want you to stop drinking alcohol for the whole month. So that's a good start before we have a dry South Africa. I'm pleased to state that Cabinet has approved the prevention and treatment for substance abuse disorder policy. It cannot be that after 30 years into a democracy we don't have an act of parliament to deal with drugs. The policy seeks to introduce game changers in curbing the scourge of substance abuse in the country. Secondly, the new policy will enable the sector to review current outdated legislations and address emerging trends. We are losing the war against drugs because our legislation is outdated. 30 years into a democracy. The main job of honourable members is to legislate, to come up with private members' bills, to get cabinet to come up with bills. So I'm afraid that honourable members haven't done their job. It's not nice to say that, but if they did their job, we would have had all the current outdated legislations would have been addressed. Political parties that is not governing, they mustn't sit back and just criticize. They need to come up with private members' bills and then address these, because the only job of a member of parliament is to legislate. Oversight and all that, that's important, but you must legislate. If you not legislate, you haven't done your work as a member of parliament. So a member of parliament who hasn't been involved in drafting legislation, you must go back to your constituency and say, look, I failed you. Another critical milestone is that the department has initiated a process to establish an interministerial committee to address the scourge of substance abuse. The CDA presentation will focus primarily on the implementation of the NDMP 2019-2024 by key stakeholders. And here I must commend the provinces and all the structures we mentioned early for a job well done. We spent 1.2 billion over the 5 years, but you have to add all the bits and pieces. So the narrative that has been sent, unfortunately, by the Central Drug Authority, that we only spend 4 million or 8 million, that is very misleading. It's 1.2 billion rand that has been spent over the 5 years. And that is very sad that they've sent that narrative throughout the country. Government has done a lot, the provinces have done a lot, and all the other stakeholders, but we need obviously to do much more. So the implementation of the third 5-year drug master plan, you're talking about reducing supply, demand, and harm caused by substance abuse and illicit drug trafficking, which are directly affecting the poor, vulnerable, and other key populations in our community. So we look forward to their report. I found it very exciting, although I noticed that they didn't implement many parts of the 5-year drug master plan. So they will be evaluated on the parts they have completed. So we in DSD provide secretarial services, just 2 officials, and I question whether that is enough. I question why does the Central Drug Authority board members, they are all we have, and they got to work from their bedrooms. And there's so many offices in DSD that they can use. So this is some of the challenges that we look at. It cannot be that the Central Drug Authority must be the Cinderella in DSD and in government. Thank you, Chairperson.
Thank you so much, DM. Actually, I did promise that I will never say a word. So over to you. I nearly said Honorable Maya Tulakoza.
Thank you very much, Honorable Chair, honorable members. Let me also thank the Deputy Minister for the opening remarks on our report. All the government officials who are here, led by the acting DG of Social Development, and the staff members of Parliament. We will be sharing the reports with the Deputy Chair, Honorable Chair, and we will share the 45 minutes that you have. We are happy indeed, led by the Deputy Minister, to report to the Parliamentary Committee on the work that has been done by the CDA. And allow us, Chair, to go straight to slide number 12, so that we really don't waste time. So we continue from the Deputy Minister just to also, emphasize on the actual situational analysis in our country. And we actually know that this is a world phenomenon. Drug abuse is a world problem. And South Africa plays a significant role in global drug trafficking as a transit and destination country. I beg yours. Okay, so we apologize for that. We're looking at a slide on South African situational analysis. Yes. Thank you, Honorable Member. Yes, so hopefully we'll move together. So indeed, just a summary, just to add on to the Deputy Minister, in terms of the situational analysis, as I've indicated, it's a world problem, but we also know that in South Africa, it's also actually a national crisis, as the committee reflected in the last meeting that we held. So we remain a we play a significant role in global drug trafficking as a country, as a transit country, but also as a destination country, but also as a producer of the drugs. So if you look at the kinds of drugs that we are talking about, cannabis is mostly used, not only in South Africa, but in the world. And it's used by young people in particular. You'll remember the president did say that the province that produces cannabis mostly is the Eastern Cape, but we also have KwaZulu-Natal also producing cannabis. But we know that it's now produced also for economic reasons, but we always worry about the effect on children and young people. So it's trafficked through Lesotho and Eswatini. And then we also have methamphetamine, meth in short, and this is trafficked, this is actually produced in the Western Cape in particular, and it's trafficked from Southeast Asia and West. And then we have heroin, which is also mostly used after these other drugs. And heroin comes in the form of nyaupe and wunga in South Africa. It's mainly found in the metro areas. Again, it actually affects the young people. It's trafficked from Afghanistan via East Africa and Southern Africa. And then we also have cocaine. In the main, it's common in Gauteng urban areas, but it's also found in other areas as well. And in terms of the method of entry, it comes through the ports of Durban in particular, the air and marine routes. It enters South Africa mainly from Latin America. In the main, comes from Brazil and Colombia. And then there is a trend, a new trend of the synthetic drugs. I think it's affecting more the United States, but as South Africa, we also need to be careful because it's beginning to be trafficked into our country via postal services and courier methods. So if you look at the common entry points, really the drugs are trafficked through OR Tambo Airport in the main, but also through the land borders, especially Mozambique, Zimbabwe, Namibia. And they are distributing networks of gangs, of organized crime groups, of information dealers as well. And it affects the poor in the main, in our communities, and this is a challenge, especially in the informal settlements where the drugs land themselves and other townships. And then we have tobacco, which is definitely, it's legal in South Africa, we know, but it poses a significant public health. We do, as a country, have strict tobacco control policies, which include bans on advertising and public smoking, high excise taxes, prominent health warnings. But there are emerging trends that are worrisome, including the hookah pipe, as well as the vaping, the e-cigarettes. Young people think that these forms of drugs are not dangerous, but they are dangerous. We've heard from the Cancer Association of South Africa that indeed there are concerns about these particular types of tobacco, the new trends. The key challenges have been that there has been gaps in the regulation, especially for hookah and vaping, and I think the Deputy Minister is correct to say that we definitely need to review the legislation. So as the CDA, we've given advice to government because as CDA, we really do not implement as such, except for goal number 5 and part of number 6. So we've advised government, given this situational analysis of these drugs in our country, to strengthen public education awareness campaigns to address also the misconceptions that some of these emerging drugs are actually not harmful, because they are harmful. We've advised government also in terms of policy development to regulate emerging trends that I've spoken about, and that there must be ongoing research to monitor tobacco use trends and adjust the regulations. We are aware, though, that the country is working on regulations, including age restrictions on these particular new trends, advertising bans, limitations on e-flavored liquids to reduce this trend amongst young people in particular. On cannabis, the next slide, basically what we want to emphasize here is that there is progress that is being made by our country, by our government, in that the cannabis for private purpose bill has been passed by the National Assembly in 2024, which actually regulates personal cannabis use, possession and cultivation by adults. Children who are found using or in possession of cannabis are dealt with outside the criminal justice system, because we had been concerned about that. And the Children's Act or Child Justice Act is used to regulate this particular issue. Again, I mean, there's a lot of health risks in terms of cannabis in our country. And then we have alcohol, which is really a major public health in our country. Yes, it's legal, but it impacts on individuals, on families, and society at large. And what is also worrying for us as CDA is that per capita alcohol consumption in South Africa is consistently higher than the global average. So if you look at the global consumption of alcohol, as South Africa, really, we are at a very high level. And we know that the drivers of alcohol use include economic factors, as people they use it to cope, given poverty, unemployment, inequalities, social problems that are found in families and communities. But it's also from cultural and community factors. When we celebrate in our families and communities, alcohol is used. We don't even check if the children are there, they're drinking alcohol or not. But it's also about peer pressure, bullying, and family influence as well. We all know that alcohol has a very negative health impact, and it's also a significant factor in gender-based violence, because once they're under the influence of alcohol, they can do anything, right? But we're also concerned about the prenatal alcohol exposure which is a leading cause of fetal alcohol spectrum disorders, right? And a lot of campaigns have been held, led by the Deputy Minister in the past, and hopefully the Deputy Minister will continue to lead this particular situation. But what is also important in terms of stats is that 1 in 4 deaths amongst young people, 20 to 24-year-olds, are alcohol-related. So, young people do die because of alcohol. And then our advice to government as the CDA, we've said we need to intensify public education on risks of cannabis and alcohol use, especially targeting the young people, adolescents in particular. Given this situation, we then also said there's a need for an enhancement of law enforcement to address the complex trafficking networks and reduce drug availability. Yes, there's a lot of work that is happening, but there is a need to intensify the work that is happening. And then we have advised government also to expand harm reduction services, such as the needle exchange program and opioid substitution therapy. There's a bit of a challenge on common understanding of this comprehensive package of harm reduction, but we are addressing that as the CDA. And then we've also advised on the need for stricter alcohol regulations, including higher tax on alcohol beverages, limiting advertising, controlling the distribution of alcohol to reduce consumption, and associated arms. There has been the Liquor Amendment Bill from 2016, which is still sitting in the shelves, and we say it must really definitely come out, and it must be a matter of urgency. It should be tabled in Parliament. The next slide is basically on our collaboration, because working alone as South Africa, we will not achieve the vision that we've set for ourselves of a South Africa free from drug abuse and illicit trafficking. So we've been working with quite a number of organizations internationally and locally, including UNODC, World Health Organization, the non-governmental organizations that have been called to our meetings as a CDA to engage us on what they are doing, because we are aware that health and social development are funding many of these non-governmental organizations. So we want to see whether there's value for money in terms of the work that is happening. We have worked with the African Union Commission, and we continue to work with the research organizations as well, because we have to know what is happening on the ground. So they are responsible for regular data collection. And then the next slide is really about governance issues. The reports that we have received, we are happy to report that almost all the 20 departments that are highlighted in the Act to participate in the CDA are now participating. And out of these 20, all of them have submitted reports. They've accounted on the work that they are doing. Only 4 of the national departments have really not reported, but they've given us their reports after time, so they were late. Then in terms of the provinces, we must say that we are happy with the provinces. All of them are participating, and all of them have submitted, except that Gauteng and Northwest submitted very late. That's why when you went through the the report, you didn't see reports from these from these provinces. So we're now going to look at the performance, the work that has been done on the ground, starting with the departments, and the Deputy Chair will move on to the provinces, the Provincial Drug Action Committees. So with goal number 1, which is really about drug demand reduction through prevention, education and awareness, 10 departments are doing work on the ground, and they've reported to the CDA. The work that has been done includes prevention awareness campaigns, it's social development leading the other functionaries, the other departments. They are involved in Gimoja drug prevention program throughout the country, using the young ambassadors who are really spreading the message on dangers of substance abuse. And then there are public treatment centers. Each and every province has a treatment center, and people are able to access treatment. But yes, as we were doing the public engagements, people are saying, look, some of these treatment centers are far away, especially in the rural areas. They are far away, they are not accessible, so they were saying they actually need more of these treatment centers. The minister spoke about the policy that has been developed by social development on prevention of and treatment of substance disorders, and we've been informed that this policy will then lead to, to the development or the review of the old legislation of 2008 to address the issue that the minister was talking about. As I've indicated, social development has funded quite a number of NGOs, especially the big ones, Sanka and Sadach. And a lot of work has been done in terms of working with the teenagers, their parents, and the youth. If you look at COCTA is working very closely with the National House of Traditional and Khoisan leaders in terms of demand reduction, because leaders were saying to us that, look, this thing used to be a Gauteng thing, a Cape Town thing, but now it has moved to rural areas as well. So there has been quite a lot of dialogues happening between departments as well as the traditional leaders. These traditional leaders have also engaged African Union, and it looks like South Africa is leading in terms of these traditional leaders on what is being done in rural areas to address substance abuse. Justice has produced a booklet on substance abuse, and they are distributing it just to create awareness, especially for our children and the parents. And they've developed guidelines on child justice so that we all know what is happening. Basic education and higher education are doing a lot of work in the schools as well as in the institutions of higher learning in terms of prevention programs, education, talking more about alcohol and drug abuse. And they've shared with us that the problems they've encountered is capacity constraints at district level that needs to be addressed, lack of sufficient rehabilitation centers in communities, inadequate social services professionals. So there's a need to employ more social workers to assist the departments, and lack of parental support, because parents also have to take responsibility. We must teach our children and grandchildren on the dangers of substance abuse. And then we've seen also other departments really doing a lot of work, transport, on Arrive Alive campaigns, health department, is doing ongoing work on drug awareness week. Employment and labor, they do a lot of work with the workers in the departments. And I've spoken about Treasury as well, who's playing a very important role in increasing the excise duties, and we are looking forward to that as the Minister of Finance will be sharing with the country. NPA has been doing a lot of work in confiscating a variety of drugs, and also the proceeds, and forfeiting the proceeds, and using that money in a fund that is called CARA to address the issue. And on goal 2, we have 4 departments that continue to do the work on supply reduction. In particular, we've seen the Justice and Crime Prevention Cluster working together to do inspections of liquor outlets and arresting those that are selling illegally without licenses. And we've also seen the cabinet approval of a coordinated approach to develop a comprehensive legislative reform to address substance abuse. The Justice Department has been hard at work with some of the hotspots in our communities. They informed us that, in particular, they've been to El Dorado Park and they've spoken to the Chief Prosecutor, the Head of Judiciary. SAPS has been engaging to discuss issues on infrastructural challenges, human resources challenges, but our role as a CDA is to go back to check if these challenges have actually been addressed. South African police is actually leading in terms of supply reduction in our country, on forensics, forensic evidence processing, on dealing with organized crime and syndicates, dealing with crime intelligence and operations. We had been concerned as the CDA to say, okay, you are arresting these drug traffickers, but what is the conviction rate? And they've told us that the conviction rate is increasing, and they are sitting at 96%, but it's just for the financial year under review. They are addressing border and visible policing, and they've actually been able to seize quite a number of drugs, including cannabis, meth, ecstasy, cocaine, heroin, and more drugs. They've been closing the clandestine laboratories and dismantling them. They've also been dealing with the financial crimes and asset forfeitures. If you look at goal number 3, in terms of availability of substances for medicinal and scientific use, we have one department that has reported, that is the Department of Health, who has been doing research on the capacity of selected health facilities to provide opioid substitution therapy. And then we also have SAPRA, who have reported to say that they are making a contribution on employment, employing medicines control technicians to deal with the OR Tambo and other points of entry, and also to deal with the importation and exportation of narcotics. Let me move to goal number 4, just in the interest of time. Identification of new psychoactive substances. Again, the police, working together with the other departments, have been doing a lot of work in the Eastern Cape, in KZN, in the Western Cape, in terms of identifying these psychoactive substances and arresting those that are producing and distributing these psychoactive substances. The main issue that we are dealing with also is the synthetic drugs. We, as South Africa, are part of the USA-led global coalition. We hope the new president is not going to squeeze us in as far as that is concerned. DERCO is doing a lot of work in terms of working with the international world on drugs. And on goal number 4, again, there's a lot of work that SARS is actually doing on seizing narcotics, and there's details of information in as far as that is concerned. On goal number 5, we are happy to report that the governance structures of CDA are all functional, and the only thing that needs to happen really is strengthening the secretariat. But we are happy to report that we've met with the ADG twice, we've met with the minister, we've met with the deputy minister, and they've committed to address these particular challenges. As the DM was indicating, there's just 2 secretariat and it's not enough. The main challenge is that of local drug action committees. Out of 257 municipalities, there's only 118 local drug action committees. So this is a very big problem, but we continue to work with SALGA, we continue to work with COCTA as well to establish this. But the main problem is resourcing of the local drug action committees, and the DC will unpack on that. CDA has done some work, and I think I'm going to move forward because we don't want to waste a lot of time in terms of capacitating the departments and PSAPs. I'm going to then move to the item around the challenges, that's inconsistent departmental participation. Even though all of them are part of the CDA, sometimes you get 10 members participating, sometimes you get 14, not all of them at the same time. The budget limitations, as when we discussed with the ADG, we have a way forward to say that let there be an audit of actually, where is the money going, and then we can address the needs of the CDA. But we're also looking forward, DM, to the intervention with those 4 departments I spoke about that are not accounting to the CDA. I'm not going to talk about international relations because we are complying. As a country, we report to AU, we report to United Nations. But let's go to goal number 6 as I move towards closure and handing over to the DC. Research, development, monitoring and evaluation. We've seen some departments like DSD developing substance abuse electronic reporting system to assist us with the data. But health department also works with Sakendu, they work with the South African Medical Research Council also to produce data on a regular basis. Justice also produces data, especially on children who are in conflict with the law. As the CDA, our main role is really to oversee and monitor the implementation of the National Drug Master Plan. And we have been consistently doing that, and there is some improvement, but more and more work needs to be done. And on goal number 7, here is a very, very big challenge where the economic cluster departments are really not reporting to the CDA. So we don't know really what is happening. How are they addressing poverty, unemployment, and inequality through economic growth? But we do get reports from the provinces. So, you know, the social cluster is doing some work in terms of the anti-gangsterism strategy in high-risk districts. So, we need to do something in terms of this aspect of the National Drug Master Plan. I'll hand over to the DC to take care of the provinces.
Thank you very much, Chair. And we thank the Secretariat of the Portfolio Committee because we understand that this presentation was received by all members. So as we are running through, we just apologize that we might be moving a bit fast, but just being cognizant of time. So what I'm going to present on is the performance by the Provincial Substance Abuse Forums. We have 9 provincial substance abuse forums, with one of them, which is the Northern Cape, having been re-established last financial year. So their report may not have come through as cohesive as the other departments. And as the chairperson has indicated, the province of Gauteng and Northwest, where they submitted their report rather late. So you will not see them reflected here. It does not mean that we do not have the information, we have it, and it is reflected in the annexure of the annual report. So should there be a need to get that information, we can go there and look at the annexure, but we would not have presented it here because it was submitted late. So in terms of the work that the PSAVs have been doing, and as I've indicated, they are all functional, they are all working. They have chairpersons that engage quite actively with the Central Drug Authority, which we are thankful for. And the Eastern Cape has presented what they did, and mainly it's around prevention programs. So may I not go line by line, but just give an overview of what the department, what the PSAVs have been doing. All of them have been working on prevention awareness programs. All of them have been dealing with issues of treatment. And on that one, what we have noticed is that because the PSAVs are led by the Department of Social Development, a lot of the work that the PSAVs end up focusing on is around treatment and prevention, for no other reason than the fact that because all of them are led by the Department of Social Development. And this is something that we need to figure out how to deal with, because the National Drug Master Plan, as well as the Provincial Drug Master Plans, have all the departments having interventions there that they need to be implementing. And then you cannot have a situation where the PSAVs are focused on just one particular aspect, because we have an understanding that the issue of substance abuse is, it requires all sectors of society. It requires all the departments, it requires the stakeholders, it requires everybody to be playing with us this game. If they are not playing with us this game, then we're not going to win. So that's something that we want to just bring to the fore to say, in terms of drug demand reduction, the challenge is we are seeing work that DSD is doing provincially, but then we need every other department and all the other stakeholders to be part of the solution. I am just going to jump and go to supply reduction. And on supply reduction, all the PSAVs as well, they're implementing, and that one is very easy because police arrest. You know, the easiest thing to do is just to arrest people and find them with drugs, even finding young people with just a little tiny amount of drugs, and then we arrest them. And then we're able to tick the box to say we have arrested, and we are able to say we have done supply reduction. But it needs to go further than that. We need to also, on this one, make sure that as we are arresting, And as we are saying, we're rehabilitating people. We're also providing all the other structures, and we're making sure that everything else is in place to ensure that those people that get into the correctional services system and that are arrested, there's no coming in and out and coming in and out. But we're able to then also protect our young people from being arrested by the police, even for the minute, and whilst at the same time we're letting go of the big drug dealers. This is something that we need to be dealing with. So all the provinces, as I've said, they have reported on supply reduction, what they are doing, which is mainly around the arrests and the confiscation, and then the issues of the liquor traders, illegal sales of liquor, and that is something else that all the provinces are busy with, which we are quite grateful for. The other thing that we realized as the Central Drug Authority is we have a challenge with capacitation of the liquor boards, because there's so much illicit liquor in this country, and there are so many illegal establishments that are continuing to operate. And the main reason for that is because all the liquor boards, the one thing that they have said as we have engaged them, is they do not have the capacity to be shutting down all these illicit and illegal establishments that exist. We were fortunate enough in December to be assisted by the Department of DSD Comms. We engaged with mainstream media around the issue of liquor trade in Limpopo. I'm sure a lot of the members of the committee were aware that there was a whole hula-baloo around the fact that Limpopo wanted to cut trading hours. So, assisted by the department comms, we were able to then go on the mainstream media to talk about the fact that in as much as we are saying we're not shutting down, we do not want to cut the economies and the economic issues. But there has to be a realization in this country that we have got a very real problem with liquor, especially when it comes to young people. And we cannot be allowing it to just go on and have absolutely nothing that we are doing simply because we're saying we need the money more than what are we saying as a country we need the money more than we need the lives of our young people. So those are the conversations that we're needing to have. And the PSAFs have been hard at work pushing this, but at the same time, without the support of the other departments, including the economic cluster departments, because, for instance, in the provinces, those are the ones that are responsible for the liquor licenses and all that. So they also have to come on board and let it not just be SAPS alone that needs to deal with this. And I'm going to move quickly to goal number 4. Goal number 3. The PSAFs do not report on this goal. It's because it's a national competency. It is SAPRA and the Department of Health that is busy with that. But the provinces, all of them, they are supposed to report on goal number 4, which is the identification of the new psychoactive substances that the chairperson mentioned, which is a very big problem. We are starting to hear rumors of fentanyl in the country. They are not confirmed, and SAPS so far has indicated to us that it is not at crisis levels yet. But the one thing that we do not want is to become the next Sierra Leone. I'm sure members are aware that in Sierra Leone there's now a state of emergency because of this issue of substances, especially those new psychoactive substances. So we do not want to get there. And for us not to get there, we need to get the reports from all the provinces so that we are aware what's going on. Because for as long as even SAPS and the forensic centers are not able to get those drugs and those confiscations coming from the provinces, we're not really aware what's happening in the country. We're going to hear a rumor here, a rumor there, and then we're not acting in time. You know, and that's the one thing that we need. We need to get ahead of this. We cannot allow it to be the thing that we're running behind, like what's happening in the United States. The one way to make sure that we get ahead of it is by getting the reports and ensuring that even the communities on the ground are aware, because that's another thing that's supposed to happen. People are not aware that these things are actually happening in their communities. So we do need to figure out how then we push the prevention awareness, we push awareness even of the new psychoactive substances to say, when we say there's a new psycho, what are we talking about? Because it's a big word. We're just talking right now about Abokoko, Sasa. They don't understand these big words. We need to bring it down to them to say, when we're saying there's a drug, what is it exactly? But that requires communication. So in terms of goal number 4, we have received reports from Eastern Cape and Western Cape. Western Cape is quite good with picking these things up, as well as the Eastern Cape Day report. But those are the 2 provinces, unfortunately, that have given us reports on that, and that is definitely not okay. In terms of goal 5, governance and accountability, as I've mentioned, all the provinces have reported, and all the provinces now have established provincial substance abuse forums. We do not have the exact numbers in terms of the functionality of the LDAX per province, but what we are getting are numbers in terms of what has been established. The concern that we have as a Central Drug Authority is the functionality, because the numbers are good and fine. You can give numbers, you can say all sorts of things about numbers. But for as long as these established, or what we are told to be established, LDACs are not functioning, and there is sort of proof that they may not necessarily be functioning, because we continue to see a rise in the issues of substance abuse. What is that saying? That is telling us already that means on the ground, work is not exactly happening, even though we are getting the numbers that they are established. The question that we need to then ask is, after the establishment of these local drug action committees, what happens? Because it may be just names, like you've just appointed people, you've got names and you tick the box that you've got names you've appointed. But is there actual work on the ground that's happening? But what we can report is, in terms of accountability, and the great thing about all the provincial substance abuse forums, they work very well with the Central Drug Authority. Whatever we ask of them, whenever we ask anything of them, they're very quick to respond. We actually even have a WhatsApp group now as the Central Drug Authority with the stakeholders and the PSAFs. Whenever there's something that's happening, we quickly get on that WhatsApp group, please give us information, and they quickly give us that information. And we've got very committed people in all these PSAFs. And in terms of goal number 6, we've got, we received reports from Eastern Cape, KwaZulu-Natal, Free State, Mpumalanga, Western Cape. And those are the 5 provinces that we have received reports from in terms of what they are doing. I'm not going to go into the detail of the data, but one of the ones that I want to just highlight is Kanyani Treatment Center in KwaZulu-Natal. When we came here as a Central Drug Authority in 2022, if I'm not 21, in 2022 we had an oversight visit. We went to all the treatment centers that the government, public-owned treatment centers. When we got to Kanyani, Kanyani did not have, it was not registered properly. We continue to support Kanyani, and today we're able to say, and they were able to proudly report that finally there were some issues, but with the support and with the engagement with the CDA, the registration finally happened. And the other one that I'd like to mention is Western Cape. Western Cape is sort of one of the provinces that we sort of have an understanding of what's happening in the LDACs. And the reason for that is when they provide us with their reports, they're very, very granular in terms of this is what the LDAC 1 is doing, this is what LDAC 2 is doing, this is what LDAC 3 is doing, which is quite helpful because then we can know for sure that this particular LDAC is functioning, simply because we're looking at the report and we can see that there's work that's being done. Goal number 7, the 4 provinces highlighted there have reported, and we truly appreciate the work that the PSAFs are doing. The PSAFs are providing a lot of opportunities, economic opportunities and training, skills development for particularly people with substance use disorder, or people that have just left treatment centers, or people in aftercare. They are assisting with that. But we're still saying, as the chairperson did say, we do need, even at provincial level, the economic cluster departments to just come on board. We cannot continue to work in silos and work thinking that this is a problem for social development. This is not a problem for social development. This is a problem for all of us, and we need to understand it as such. Mpumalanga as well as Western Cape also presented on this, and I see my time is running quickly. So I am going to go, and in terms of the local drug action committees, the chair has indicated that we've got 118 that have been reported as established. But as I said, established and functionality, those are 2 different things, and we need to be looking at that. In terms of, we've got in slide number 50, the members did say that they're not numbered, but I'm sorry for that. I don't know what could have happened. We've got analysis of PSAF implementation, and I would just want to just focus on the recommendations, which is what is our advice to the portfolio committee as well as to the minister. 1 is to standardize prevention programs. The programs must align with UNODC and WHO standards. We cannot be doing things that are not evidence-based. No matter how great we might be thinking that this program that we're doing is working, for as long as it is not evidence-based, it's really not something that we should be pushing. We understand that in communities, people are being chained, which is wrong. It should not be happening. Others are being prayed for. I am not sure about the evidence base there, but anyway. We're asking, can we just stick to the UNODC and WHO standards? They are there. And the Department of Social Development can give them to everybody. They have been trained. They are the ones that should be leading on that. And then enhance stakeholder participation. We need to improve reporting by all provincial departments. As I have indicated, the reporting is sort of not consistent. Some report a lot and they give us a lot of information, but some just give us just a one-liner, which is a problem. But our secretariat has been assisting in trying to capacitate the provinces in terms of the reporting on the National Drug Master Plan. Because there's reporting on the substance abuse programs that the department is doing, but we're talking about the National Drug Master Plan, not necessarily just the programs of the department. They have done that, but I do believe that we need to continue and do more of that. Focus on harm reduction, the chair spoke about that in terms of what we need to do around that. And harm reduction, we're talking in terms of even the alcohol harm reduction. We need to be looking at that. We need to focus on it. So we need to expand that and make sure that it goes beyond the inpatient treatment, because currently we are focused on inpatient, whereas we can perhaps do more if we get into the communities and if we move from wanting to place people in treatment. One of the things that the Department of Health has told us, our representative from the Department of Health, is not everyone needs to go through detoxification before they are assisted. So what we're finding is there's a whole line and a long queue of people because we are insisting that people need to go to detoxification before they're assisted. So those are the things that we need to be looking at and see in the communities. Can we perhaps use the primary health care centers to provide some of the services? Because that might be easier than wanting to put people in treatment. We need to expand economic opportunities, capacity building. We need to train professionals. They have been trained, but we need to do more of that in prevention and treatment. We need to address the illegal treatment centers. That is another big one. As I mentioned, there's people that are being changed, there's people that are being prayed for, there's all sorts of things, shenanigans happening in our communities. We need to figure out how then do we address that. But one of the other things that we need to acknowledge is for as long as people do not have solutions, they will go to the illicit and illegal treatment centers. Because if I'm sitting with my child at home and that person is terrorizing the whole family. If you tell me that as when I'm Mamuzbani, you have this little thing that's happening there, if the family is so distraught, we'll just go to that illegal treatment centers. So perhaps what we should be looking at is how then are we making sure that people, one, are aware of the illegality, are aware of the dangers, are then also informed of where to go should I have a problem with the person. And for as long as we're not addressing that, we're then going to continue seeing this illicit, because people are looking for money, people are wanting money. For as long as there's an opportunity, people are going to take it and use it. And then the increasing of public awareness, we need to do that. The LDACs. In terms of the LDACs, if we can manage to establish and functionalize LDACs, our problems, I want to even bet my life on it, would be over. Because these LDACs are sitting right where the community is. Those are the people that know what's happening. They know Lapistrati, like that street. They know what's happening. They know who the drug dealer is. They know who the child is that's taking substances. They know everything. But then we have not, unfortunately, put our attention on that. CDA is fine. It's at national level. And we are responsible. We don't even implement nothing. We just oversee, we collaborate, we coordinate, we support, we do all those nice fancy name things. But the thing that we need to make sure works is the LDACs. We were so excited when the Enyobeni tragedy happened and the president mentioned LDACs have to be, as the CDA, we were clapping hands, we were so happy. LDACs will be established. Unfortunately, nothing has happened. So we need to change that. And then the other thing that is happening is, there's an issue of the audit. I would say we've been talking, when we got into the CDA, chairperson of the portfolio committee, when you appointed us, the first thing that we were told was there needs to be an audit of the LDACs. There's still that same language. We need to audit the LDACs. Can we just get it done? Why is it that we talk about what needs to be done without doing it? And we know that the answer lies in that. So can we focus on the thing that we know can work? We've got a legislation that is very enabling, that will allow us to do stuff. Can we just use it and get things done? So in terms of the LDACs, our key recommendations and advice are the establishment and the functionalization. We need to engage mayors and municipal leadership to prioritize. The CDA has engaged, and we've engaged all of them. We went when Salga supported us. We went to all of the provinces and we sang the song and we said the words, but unfortunately nothing has happened since, except just a tiny little rise. But it shows that it's just not being done. And then we continue to collaborate with Salga as well as COCTA. And in terms of the other thing that we're saying is we need to strengthen coordination and communication, and we need to support the PSAFs to be able to support the LDACs in the provinces. We need to ensure that when the LDACs are appointed by the mayor, they are immediately inducted to say, this is what you need to do in the community. And in those LDACs, can we please not have people that are there to sign and say, Mina, I am a member of an LDAC and do absolutely nothing? That is our plea. Can we please focus on people that are actually interested in helping their communities and making sure that the work that needs to be done is done? There's going to be instances when you do not get paid. There's going to be instances when you need to use your own resources. Can we please have people that just have that kind of interest to say, yes, this is going to be done? Because my community needs to be healthy, my community, and the LDACs need to do that. And in those LDACs, we need to have the traditional leaders there. We have engaged with the National House, and we made them aware that please go in all your communities and ask your mayor, why is it that this LDAC does not have a traditional lead? Or why is it that we do not even have an LDAC in this particular municipality or in this particular area? So that's what needs to happen. And then we also need to increase the community engagement. What we do not want to see is LDACs that are appointed for 5 years, and then after 5 years, they leave, and we're like, how? There was an LDAC here. Can we not have that situation? Communities must know that we have a local drug action committee, and in that local drug action committee, there's also perhaps a liquor officer from the SAPs in that municipality, because every municipality has SAPs, and that SAPs has a liquor officer. Can those also be part of the LDAC? Just before I've got 2 minutes now, human resources and organizational environment. This is something that we have spoken about and we have presented before, the issue of the CDA director. We did indicate that we have our 2 secretariat, but they are officials of the Department of Social Development. They do not directly report to the Central Drug Authority. They are not directly instructed by the Central Drug Authority because they are officials of the Department of Social Development. So which is then problematic for the Central Drug Authority. So on this one, what we are saying is we are asking and we are calling again for a director to be appointed. And that director must understand that the work that they need to do is not necessarily work that is around the Department of Social Development, but it is a secretariat function, like a board secretary. That is the type of person that we need, not somebody who is going to be focused on just one particular department, but who will see this as a holistic thing that they need to do. We do have a challenge with blood reporting and communication lines between the Secretariat, DSD, and the CDA. It's something that we're engaging with the Minister and the DM, and we're trusting that it's going to be resolved. Then the budget, we had over expenditure in the previous financial year, and this was due mainly because to the fact that we had a national summit. We had not had a national summit or biennial summit in this country since 2011. There was a challenge with finances, we are challenged with finances currently, and there was an issue with budget. So the members of the Central Drug Authority, who are the independent members, ended up we did not have a service provider, so we literally did the work ourselves. We did the going to the provinces ourselves, we did the bringing together, and we were supported, thankfully, by DSD Comms a lot on the event, on the day of the event. But before then, there was so much work that needed to be done, which involved the independent members, which then led to a lot of a cost rise. We do understand, though, that this budgetary constraints, there's been a mention of 1 billion for the last 5 years, and there's been an issue of the 4 million that is given. The CDA receives 4 million from the Anti-Substance Abuse Directorate. So in the org structure, of social development, you will not see, or maybe from Treasury, you will not see a line item that says Central Drug Authority. It doesn't exist. So what happens is money is given to the department, and then there's an allocation for the Anti-Substance Abuse Directorate, and then that directorate will give the CDA that 4 million to say, this is what you are going to use for everything that you do, which is then what we are saying is a challenge, because we have indicated that the Central Drug Authority, according to Act 70, has 13 major responsibilities, major, and there's the last one that says any other duty that will be given by the minister. So it's not just the preparation of an annual report, the National Drug Master Plan, the Pioneer Summit, but unfortunately, the focus is often on that when it's 13. And this particular Central Drug Authority has decided that all those 13 responsibilities that we've been given will make sure that it happens without even having the Secretariat to be able to do the work. Because our intent is, when we finish our term, the minister did say that we've got eight months. When we finish this term, we need to be able to say, this is the work that we have done, and we have done it to the best of our ability. So the recommendation on that, which is our advice, is the capacitation of the CDA Secretariat Office in terms of financial management. We need to involve the CDA in budgeting. We need to adopt a realistic budget for future initiatives. And what we are saying there is, can we reference the CDA APP priorities, which are not that many, but they are there. Can we just look at them and then say, these are the priorities, and agree that this is then what we're going to do in this particular financial year? And then we are also saying, if we implement the CDA structure as per the Act, then we're not going to be seeing even the problems of over-expenditure, because then there will be people in the office that are actually doing the work, and then the claims that are always complained about will then not even be a thing anymore. And we need to deal with that, and we understand that that's something that is a problem. So the last slide is on recommendations, and I think the recommendations are basically everything that the chairperson and myself have said. And the big one that I would like to please just focus on is, can we have a major prevention awareness campaign in this country? Our friend in the United States, the one that is making us feel emotional a lot these days, said that's one of the things that he's going to do. There's never been prevention in this country. And we were like, yeah. But that's not true. There has been prevention in the USA. But okay, what we are saying as a CDA is, can we have this massive prevention campaign that will talk about all the issues that are around substance abuse? And let's see if once we have done that, we still continue to have the problems that we're having. And of course, the implementation of the National Drug Master Plan in its entirety by all the departments, by all stakeholders, by civil society as well. And with that, we will conclude, and we were saying that the AR reflects a year of significant achievements, and indeed there have been significant achievements, but we also acknowledge that the challenges still persist, and we are still committed, even as the CDA, to seeing a country that is free from the harmful substance use. Thank you very much.
Thank you so much for this presentation, which I believe really covered the issues as we see them, as we walk around in our constituencies and in the country at large. I don't know if before I hand over to the Portfolio Committee, honourable members, if the chairperson wants to say anything, or the Deputy Minister, before I hand over to the honourable members for their comments and deliberations.
Thank you, Chair. I think it's important to start with a budget. That budget is allocated by Treasury, not DSD. We can't break the law, which the Central Drug Authority wants us to do. The legislation is quite clear when it comes to the mandate to appoint the Secretariat. It's only DSD that can appoint it. So to ask us to break the law, that is not on. Change the legislation. I've asked for that earlier on, but we've got to work according to the legislation. So it is the Section 60 requires mayors to form local action drug committees, and we had good advice from the chair and vice chair that once the action committees are appointed, the mayor must provide the necessary funds to capacitate them. So we also heard the call for a national preventative campaign. I think that is something that we must consider. But it seems as if, government hasn't been really serious about fighting drugs. Creating a central authority, and they have no teeth, they have no budget, they got to operate from the kitchen or the bedroom. I mean, you can't, after our Uhuru and our liberation, the next thing that activists wanted to get involved in was to deal with drugs and deal with gangsterism. And many of them are doing it, and they should be the members that should be on the local action drug committees. But they are prevented because people didn't want us to liberate the country from apartheid. They don't want us to sort out the drug challenges and the drug problems. I think we need to engage Treasury. I don't know how we're going to do it, but there's about 8 months left for them to complete their task. One of their tasks is to advertise for a new committee. But they got to wait till April because there's no funds to put the advert in the newspapers. That's unacceptable. We're not a Mickey Mouse government that don't have money to put an advert to bring about a new drug central authority. So we're going to advertise at the last minute, and we're not going to get the best people on the committee. Having said that, I've been given the delegation. And this is the first time that I have a good idea of what the challenges are. And we're going to try and do our best. Thank you, Chair.
Thank you, Honourable Deputy Minister. We, towards the end of last year, that was the last bill that we dealt with as the Portfolio Committee, and that was an executive bill. So the executive can actually see the implementation of an act and see the gaps and come up with a bill to do amendments to that act. So what I'm saying is I'm retaining part of the ball, but I'm throwing it back to the executive to say, we have seen this, it has been in each and every meeting that we've had with the Central Drug Authority, the issue of them being housed internally in the department, and that stifling any effort that they would like to make a dent on the drug issue in this country has been stifled by the fact that they are under a directorate in the department. So we all need to work on this, Honourable DM, because we can't keep talking about it for as long as we have. It's just not justice to the young and old people in this country who are trapped in the drugs and so on and so forth. So I take your comments, and I believe the honourable members will have something to say about this, because it for me is much of a crisis as gender-based violence and femicide is in this country. We just cannot. I have considered you, Honourable Mare, Honourable Ra Maila, Honourable Mtsweni, Honourable Monyai, Honourable Mkhatu, Honourable James, Honourable Mhlongo, and Honourable Tafeni. And Honourable Abrams, in that order. I think we come from Mare this way, and then we go back to Abrams and Tafeni. Thank you so much.
Thank you so much, Chairperson. Chairperson, I want to agree with the deputy ministers that we are not being taken serious by this government when it comes to drug abuse, because this drug abuse is a crisis, and we are having a lot of crime that is happening because of drug abuse, stolen TVs, grannies being beaten up, and even Centlec and Telkom, and all of them got damages because of this. But I want to go directly to what the lady was saying there, is that I know I am now part of the Department of Health, the e-vaping and the Pipe. They had, the beginning of the year, they are starting with public hearings on the health risk of this too. So this too is with the Department of Health. And then I want to come to the alcohol. You were talking about the licensings of the alcohol, of the liquor boards. And I must say, in the liquor boards, there's a massive problem of corruption going on. Because a lot of companies and a lot of taverns and whatever you call them, lounges, whatever, some of them are complaining that these guys want to be paid before they can give you even a license. So some people that are getting the license are the ones that bought the license, but the ones that must get the license are not getting it. They are struggling to get those licenses. And then I also want to say, no one is talking about the mere fact that we are having adverts on TV on alcohol all the time. So children are thinking it's a normal thing, you know, they got all the different colors, the peach and pink and what, and it is nice because that's what's happening on the TV. So there has been discussions a lot of times of how they're going to take these adverts out of SABC breweries and all those things. The concern that I'm having, where I'm coming from, I like to talk of where I'm coming from because that is my constituency. Every year when schools are closing, grade 7 children are walking around with alcohol as strong as whiskey because it's the closing of schools. And these children are underage, but they are giving the right. If you look at what happened in the Eastern Cape, where all these teenagers were dying because of alcohol, and what is happening with the tavern owner, they only got a fine. I want to agree with the ministers that, you know, CDA doesn't have teeth to bite. They don't have anything. The mere fact that they are even asking you, you know, we need a director, and we don't have a director. And it is looking like the 2 secretariats, like the spies is working there. They are looking, but they can't do anything to the 2 spies because they are reporting to another department, you know. And that is where the problem is coming in. There is no continuity because every 5 years, new people come in. Where is all that the knowledge going to? Where's all the hard work for the 5 years going to? Because there's no one that's following up because it's a new team coming in, new training, new everything, and that is a very huge concern for me. I have a problem with goal number 1, basic educations. If you look at the basic education, department trained 27 schools on drug testing. I mean, how many schools do we have in this country? And you're talking about 27 schools. If you look at the higher education, you were basically saying here that 575 students were through the awareness campaign. How many children do we have in higher education? That is not even, as nie 'n druppeltjie in die emmer is nie. Nie 'n stukkie, net so 'n klein bietjie het aangeval. So that is a huge concern because drugs is happening at schools. And while we don't have awareness campaigns at schools, there's going to be a problem. The lady was just saying now that, you know, we get all these drug institutions, the church that is praying. In my street, there's one like that. And they get excellent results. They are praying, they're coming and have all these things in the streets. They go to all our schools to go and explain to these young children about the awareness of drugs, what is drugs doing to a family. And then you have a drug center in Bloemfontein, in the Botshabelo, a state-of-the-art drug center. And they know what I'm talking about. That is not working. There's not one person there. You got the gym, you got the hairdresser, you got the kitchen, you got TV facilities, you got even for children from 12 years on, different rooms that is got nice Pinocchio and all the base and things on, is standing empty. There's nothing going on, and we're having a crisis in this country. The other topic I want to discuss is this thing of cannabis. Cannabis is like, you know, people are not talking so much about cannabis. But you know, the problem that I have with cannabis nowadays is not like dacha that you see the green leaves. They're making teddy bears and sweets and all these nice things. On the corner here by Parliament, there's a shop here. As you go out of Parliament's gates, there's a shop. I thought it's a candy shop. I wasn't aware. It was only when the guy started talking to me, "Hi, ma'am, how are you?" So now I'm fine. I said, "Oh, but you got nice sweets inside here because it's so colorful." And then the guy said, "No, ma'am, it's not sweets." I said, "What do you mean?" And then he explained to me on the piece of paper, and he's telling me, what is this one doing? And then you get high grade, and you get low grade, and you get teddies, and you get sour sweets, and you get all those things. What if that goes to the schools? Because children are thinking it's sweets that they are eating. Huh? It was mind-blowing for me. I went in the shop because I couldn't understand. My God, you're getting sweets now. It's cannabis. And it is so expensive, some of those. So that is a huge concern. And these people are legal. They got licenses for this, to sell these sweets that can go to school. Because in my area, children as young as 8, 9, 10, they go to school, they stand outside, they start smoking. They go to class. What are they learning? Absolutely nothing, because dacha, it is like freely available anywhere. Even my friends are selling it. Chairperson, I'm sorry that I'm taking so long, but you know, this thing is very, very dear to my heart. Then you have all the children, because these gangsters, it's not gangsters, it's drug dealers. They're targeting young children. They know when you are from 10, 12 to 17 years old, you can't go to jail. So they are asking you to sell these things. And if you look at this, 233 children appear for inquiries on possession of drugs. And this is the reality, people. It is in my area. Children are standing on all the corners selling these drugs. And there the drug lord is standing. And he's the one getting the money. And these children are doing it because they see, you know, these drug lords are driving with nice cars, nice shoes, nice everything. They want to be like that because we don't have role models in our communities anymore. The question I want to ask, there's like Doc that is there with you said you went with the council to go and discuss this thing. Every councillor in the community is having a ward committee. You were talking about they're not getting paid, so they're not going to do anything. The municipality was supposed to come up with a mandate to say all councillors that is having because they have a committee there that is being paid by the municipality. That is part of that can be part of that like Doc committee doing the work while the municipality is paying for it. Because I only found out last year that Mangaung municipality, Metro, is having basically a budget to have drug campaigns. But they've never used it because no one ever came to ask them for it. But we're having a crisis because the street next to mine, there's 8 drug houses in one street. They call it Sevendelaan. Because everything, the people don't sleep there, it's like a whole night up. So I just want to find out, can't you go back to these municipalities, because they do have budgets. They do have ward committee members that's being paid by the municipalities. Why can't they give that responsibility to those committee members? And then...
Honourable, my sincere apology, Honourable Mare. We, the honourable members, took the time in the beginning of this meeting to talk about the urgent matter that we talked about that has eaten into the time, and we have a sitting this afternoon. If I may please ask that we are as brief as possible so that we give them the chance to come back to us and comment on our questions, please. I've never cut anyone, but I do have a responsibility to do this today.
Then my last question, Chair, I will cut my things because I have 2-3 pages full here. My question that I want to ask, she was saying that they get information from provinces and regions, no? And they are quick to report on what is happening, and what if they want stats, they get it. I want to know, how do they verify the things that the information that is being given to them from provinces and regions is really like that? Or is it just being made up quickly because I must report, I must comply? I just want to know that, Chairperson. But otherwise, I stop there, Chair. Thank you.
Thank you so much for your understanding. Honorable Ramaila.
Thank you, Chair, and let me welcome the report from the CDA. And indeed, you are having a daunting task in your hands. It's a daunting task in your hands because you might then even find that the majority of us sitting here as politicians, it is our kids that normally gets targeted. So it's a matter that really needs to be attended to. But besides being mechanical about the matter, the presentation has been in a political context. And I think that's what we really need to deal with. And that talks to the communication that must go out there. Just to say, for instance, if you look at the communities that are largely affected are black communities. So that's why I'm saying we need to put a political context to the matter. That black communities were destined by the architect of apartheid to be reduced to useless bodies. Now, we are dealing with that broader political context that is historical. So in our approach, you don't need to be mechanical about the matter. We really need to also take that context into consideration as in terms of our approach. I think that will be very necessary. Now, that will mean, other than thinking much more about the bled reporting lines, we still have to achieve the context that I've already mentioned as my preamble that we really need to look into. Those are other matters for me are operational matters that might be cleared later as we implement the program. But again, the establishment of the local drug action committees, and I know it's reflected that normally municipalities take it as a unfunded mandate. It's just like AIDS Council, those of us who have experience of the local government practice. And indeed, it will not be taken serious at that level because municipalities themselves have so much to deal with and they wouldn't have that time to pay attention, though they might know that this is a matter that needs serious attention. So we really need to sharpen the strategy. And I agree with the DM that once the draft comes to the committee, we really need to really apply our minds and be able to really redirect in a matter that will be able to deal with this social ill that we are faced with. The financial report that we've been provided, I can't make sense of it. It has been mentioned there's 4 million somewhere else that the CDA reserves. I don't know how the boost gets audited, but we do not have an audit report. For me, which is very, very critical. The good work you are doing is fine, but you also need to account in terms of the resources, financial resources that you are receiving from government or wherever you might be receiving. So therefore, Chair, I hope at some point we'll be able to receive an audit report on all the finances that you are receiving, whether through government or through donation whatsoever. So we could be able to have a picture of how you are managing resources, even before you can think of other things. Central, Chair, is that, because this matter is quite a matter that requires this interdepartmental matter, it might be necessary at some point for the DM DPME to be invited, because they must play that critical role that are required to make sure that other departments that are supposed to be playing an active role in this matter, which are not on board, that should be brought on board. Maybe my last part, I think Honorable Maria has mentioned it. My observation in Cape Town, since I've been here, is that I think there's an abuse of the medical cannabis. It's regulated, but I'm not sure how to what extent the regulation goes. But I see Cape Town continuing to push, and licensed, but continuing to push the selling of these drugs. And lastly, Chair, I know that when I say don't entask, because it's a business that is controlled by the underworld. And this is a business that has co-opted politicians, has co-opted police, and has co-opted quite a number of influencers in the country. So the strategy must be able to deal with those matters, so that we must be able to find a way of having a handle over this matter and crack it down. Thank you very much.
Thank you, Honorable Ramaila. Honorable Msweni.
Mphathishlalo namalunga ahloniphekileyo angibonge. Ngizoba mfushane kakhulu. Inkinga yami ukuthi angazi ukuthi kulama report indawo zethu zasemakhaya zibaliwe yini. Ngoba mina lokho engikuzwa la asilwazi usizo noluncane eindaweni zethu zasemakhaya. Ngangokuthi Mphathishlalo asiyazi ne social worker eindaweni zethu zasemakhaya. Neingane zethu ezifundayo ayikho ingane eke yaba ne-interest yokuba i-social worker because ayikazi ibona i-social worker. Noma siya emakliniki, noma sidlwenguliwe, noma sishayiwe, asiyazi into ewusizo. Ngesikhathi thina usizo lungafiki kithi, abadayisi beyidakamizwa bayafika. Ama-drugs ayafika deep in the rural area, kodwa usizo asikwazi ukulithola. Umbuzo wami uthi kuyofika yini lapho abantu base South Africa belingana khona ngokuphila nangokwamalungelo. Usizo olutholakala emadolobheni, usizo olufika emalokishini luyoke lufike yini eindaweni zethu zasemakhaya. Ngiyabonga.
Siyabonga sisu Mthweni. Honorable Munyai.
Today was bad day, Chairperson. When I arrived here, we were locked in the lift. One of the officials tried to phone the secretary and it went on voicemail. Other than being late, other than that confusion of thinking that it was online meeting. Firstly, I must thank you, Honorable Chairperson, for giving us opportunity to engage with the reports. But first, it will be misleading and amiss of us to blame government on the question of drugs, because no single government department is manufacturing drugs, nor any entity. The problem is with the drug dealers. And the second problem is alcohol companies that bring alcohol. We drink, binge drinking. When we're drunk, then we can even take other substance beyond this substance, which is alcohol abuse, binge drinking, and also other, we are able to do many things when we are drunk. Lots of things. Some of them, they land us in a big troubles. But I'm saying this in the context of drugs, drug abuse and so on. Chair, in our previous meeting, we pronounced ourselves clearly and vividly that CDA is not a public entity or Section 3 entity. and shall not be one. That pronouncement we have made in the previous meeting. And they should not attempt to act as one. I said it, if you need a point of reference. And if you can go to the records, you'll find it. And they should not attempt to act as Section 3 entity. You know, they should not attempt to do that because they are not such an entity. Did I hear the entity correctly to say that they also report to AU and to the United Nations? No. She was saying the issues of the chair raised issues of the AU. Yeah, no. Because the clarity to me, in my view, is that you are an entity that must report to the department and to the portfolio committee. No, you raise your views. Don't just make noise while we're speaking here. Please, it's disrespecting others. So I'm saying, therefore, they'll also report to portfolio committee, but they also, and maybe I must ask a further question. On the challenges they are raising, did you raise it with the minister? Because sometimes, or minister and the deputy, because sometimes we may behave as if we are solo. We don't raise issues with the ministry before we come here. In your coordination, to what extent did you understand the socio-economic profile of alcohol attributable to the mortality in South Africa, including disability, if you do that? So I think principally, Chair, the entity must stop mourning. CDA must stop mourning. They must coordinate the broadest sectors of society. Broadest sector, when I'm saying broadest, whether it's, faith-based organization, all these sectors, and those structures of government already in local municipality, they've said they're working with them. The broadest sectors of society. Some will be within the state, some are non-state actors that are very influential, that can help in this campaign against the against substance abuse and prevention. So, Chairperson, and I think finally they must report on the implementation of the work, because it does not begin with the master plan and end up with the master plan. There have to be practical implementation consistent with their mandate, as outlined by the Act. Can the CDA clarify to us the contradiction with respect to the money spent? The minister says it's 1.6 billion vis-a-vis the 4 billion plus and so on. Because that clarity is very important, Deputy Minister. It is very important. Because if there's contradiction and it's being reported before us, I will take it that it will be hypothetically misleading, if the figures are not aligned. If it's not by accident or by mistake, because even if it's a margin of error, you can't have 1 billion to 4 billion plus. I mean, that's a very big variation in my interpretation. And I'm sure the issues of resources, you can't say, deputy ministers, you don't know how to engage the treasury. It can't be. You must engage the treasury. You know how the treasury is engaged around issues of funding. And the official that sit in those committees, you have to engage with the minister, deputy minister. So resources, I think it must be addressed so that the mandate, the legislative mandate that we're talking about must be fulfilled. Lastly, Chair, because you caution us about time, I would want us to, maybe I must ask it to you. You are saying the minister says your term is ending in 8 months. What do you say? What does the legislation say? Because it can't be the business of the minister alone. You should know when your term expires. You can't come and say, minister says our term is finishing 8 months. As if is the minister telling you that you must end up your term within 8 months. You said it here on record. Minister said our term is finishing in 8 months. No, you said it, the deputy chair.
Sorry, Honorable Munyai.
Okay, no, I'm done. Thank you.
Yeah. Honorable Mkhatu.
Thank you very much, Chairperson. I just want to thank the reports, and then I've got only few questions. I just want to speak about the South African situational analysis, where it speaks about the heroin, the cocaine, and other things. So according to me, those are the key challenges of how going to achieve this situation in South Africa. So if you can check the young, the rural areas, it's a difficult situation. So alcohol also bring disaster in our villages, especially in the rural areas. So I don't know how the department can assist us. We are in serious trouble and we can see it. And then secondly, I want to speak about situational analysis again, which recommended intervention plays a major role. Or as the department, you are recommended, and also under you play the major role, and I think on your side is fine. Some department did not submit the reports. So my question here, I want to say, what are you going to do with those departments? The 4 departments. So I just want to check with you, then what are you going to do with those 4 departments? Another thing, okay, the demand of reduction. You spoke lengthily about them. So I just want to check with you whether they are affordable. But I'm very much happy because you said, bargain, your governance and accountability. So maybe you can give us the outcome on this issue. So I don't know what's happening, but you reported more on demand reduction. And then research, development, monitoring, and evaluation. How are you doing your research, development, and monitoring? You also mentioned this event, so maybe you can also tell us about this one. Then my last question, who is responsible for drug action committees? Because you said the municipality, but in other events, we can hear people crying as if they are not getting money. So I just want to check whether they get salary, whether they get grant, so at least if they can tell us something on that issue. Thank you very much.
Thank you, Honorable Mkhatu. Honorable James.
Sure, thank you so much, Chair. I'm deeply concerned today. I'm deeply concerned at the fact that we can ask the CDA to come do a presentation on their annual report and we tell them they cannot come here and moan. that is extremely disrespectful for the work that they have done, under great pressure, under great duress, with with absolutely no budget, because 4 million rand, we cannot say that that's a budget. Minister, you started off earlier on and you said, you know what, we cannot go against the laws, while at the same time you're contradicting yourself and say that we are the lawmakers. 1.2 billion spent on substance abuse. That 1.2 billion was not spent in alignment with the National Drug Master Plan. Why do we have a National Drug Master Plan that speaks to 21 departments, that tells those departments what they are meant to do, how they are meant to do it, if they are spending 1.2 billion rand in isolation? You cannot say that the 1.2 billion rand is the money for CDA.
Please
it has
address-
absolutely...
Sorry, Honourable Member, please address me.
Yes. Sorry, Chair. The 1.2 billion rand referred to, Chairperson, by the Minister has absolutely nothing to do with the budget of the CDA. The CDA has been appointed, I think, in 2021, Minister. Already 2 years or a year, every year when they get appointed, it's already cut into the implementation of the National Drug Master Plan, which is 2019 to 2021. 8 months to go. Nobody said that the Minister said, Honourable Member of the ANC, that the CDA only has 8 months. That is as per the law, that is as per regulation. The CDA serves for a 5-year term, and unfortunately their term has come to an end. Their term has come to an end with an insufficient budget. Their term has come to an end where members weren't being paid. Their term has come to an end. Minister, you cannot say that, you know what are we doing about the LDAX? You are a Home Minister. You can write to municipalities and you can ensure that we enforce the act when it comes to the mayors appointing
Sorry,
the local...
just a point of order. Please address me.
Sorry, Chair.
Because
sorry,
now you are...
Yeah.
Yes.
The minister I'm not touched, I'm speaking facts. The minister can enforce and make sure, Chairperson, that we appoint, and we can also give support. We cannot come here and say that there's absolutely nothing we can do about it. We speak about, I want to stick to my notes quickly, I don't want to be long. We speak about the fact that there's no money. In 2013, when there was a presidential intervention in Eldorado Park, there was a special grant allocation made to various departments because there was recognition and the need, and the people spoke out. So when there's a need on the ground, surely we can sort of align and ensure that we can make special grant allocations to deal with the issue of substance abuse. To activate civil society awareness, that is also something that we can start pushing on our end. That is also something that the minister can also do. I want to speak about review of the board. This board only has 8 months left. It is said, you know what happens, Chairperson? Closer to the end, the department spends all the money. Right? Within that budget, they cram and they spend, and then they say there's no money to fund the CDA. The CDA, of the 7 million that they get, a whole 7 million, meant to do what? That 7 million cannot even support properly one province. Of the 7 million that they get, 3 million goes towards the funding for the secretariat. They only have 4 million to roll out an entire national drug master plan in 9 provinces. I think it's a disgrace. I also think it's a disgrace when we say that drugs is not the responsibility of government. My goodness. What a careless statement to make. Whose responsibility is it? When you say it is we must address the drug dealers. When SAPS gives a report and they cannot even tell us how many drug kingpins they've taken down. Why? Because they are working in isolation and the actions that they are taking is not in alignment with the National Drug Master Plan that speaks to categorization of drugs, that speaks to everyone in this country, all 21 departments, Chair. Elke ene doen net soos hulle wil en lus. And this is why we are not seeing the impact of the work the Central Drug Authority is doing. There are 4 departments that hasn't submitted their reports, and they play key roles. Department of Sports hasn't submitted what they have done. Department of Home Affairs hasn't responded. And I think there are still two correctional services where the drug syndicate is being run from our prisons, and they haven't reported in terms of what their role was when it comes to this presentation. I think it's a disgrace. Our communities are suffering. We can never say that this government does not have a role to play when it comes to combating substance abuse. To the Central Drug Authority, I hope that this committee can consider keeping you guys on for longer, because we are the lawmakers and we can do that, because you have done a sterling job with little time that you have. Well done.
Thank you, Honourable James. Honourable Mhlongo.
Thank you very much, Chair. Chair, one, seated here, I really do not believe the reports from provinces and other departments. I don't think what is reported is what is happening. That's one. Two, it is because of the challenges that are being raised as you go towards the end of the presentation. The inconsistent participation of departments working in silos, and awareness gaps. Those are challenges, and if indeed work is being done, these challenges would not be there. Two, CDA is responsible for ensuring government departments, provinces, and other stakeholders implement the NDMP. But your presentation spoke nothing or spoke less of other stakeholders. It only dwelled to provinces and government departments. There are a lot of stakeholders in our society that are there in championing or fighting substance abuse, but the presentation said nothing about other stakeholders. You spoke of treatment centers. Where are they? Which provinces? Agupi. I want to know them. If you can maybe present a list to the portfolio committee, not now, but we do oversight. We have Nyaupe people that we call Nyaupe people all over who would want help, but we don't know where to take them. So where are these drug treatment centers? Please submit that to the portfolio committee. And also you spoke of the SAPS being the department that can't be fighting drugs alone, but I'm seated here thinking SAPS plays two roles. It plays a role of fighting and a role of bringing them. They are the ones in our borders. They are the ones in our whatever. But I stay in a town called Barberton. There's a border gate that's not working, bordering Swaziland. And that border gate only has SAPS people who wake up and go and sit there. That's where cannabis is being transported from Swaziland. So SAPS plays two roles here. And I would want to know or want to hear your side when it comes to that, because we know that SAPS plays two roles, whether in substance abuse, whether it's December, they are shutting down illegal drinking places. They communicate with their people who are coming close, who are coming, do this, hide this. SAPS plays a major role when it comes to substance abuse and drugs. And what are you doing? And have you, as the authority, taken upon yourself to meet SAPS to discuss such things, apart from them playing their role that they play as SAPS, but the other role that they play, because they play the other role and they are the problem in most cases. We can form LTACs, but with SAPS they're not going to work. In as much as we've got, what do you call these in fighting crimes, police forums in our society. You know why the police forums don't work? Because SAPS is there. That's why they don't work. The minute you go, the minute they want to go and do their work, SAPS is the first to inform the people that they are coming today, do something. So those are things that you need to look also into, rather than SAPS is doing their work, they submitted, but they also play a huge role. You see, when you're here in Cape Town, I've been in Cape Town from 2019, drugs are normalized in Cape Town. You go to a club, you can tell that people are sniffing, like it's normal in Cape Town. Like not even hiding. When you enter a bathroom, you can tell that gupizila. When you sit in a restaurant at Kemps Bay, you can tell that these people down there bayating some drugs. You can tell that it's normal here in Cape Town. Those are things that make me say that I don't believe everything that's submitted here. From provinces, from government, no one is doing anything about it. There's no work that's being done, because if indeed there was work that's being done, ngabe leli zinga lema-drugs emphakathini yangakithi liyehla, ngabe bantwana labancane labanatha tshwala ngaba bekho, because when you take it back to the 90s, alcohol was not a problem. It's only started being a problem from our generation going upwards. And worse is that in the early 80s, there were no interventions by government, but yet society controlled themselves. But now we've got all these interventions in place and systems in place and government fighting everything, but it's getting worse. What is the problem? Have you looked into that? What is the problem? Why is it that even with all the systems in place, it still gets worse? So those are things that I would want to know. Thank you.
Thank you, Honorable Mhlongo. Honorable Abrams.
Thank you, Chairperson. And
I think it was Tafeni.
Thank you, Chairperson. I want to welcome the report of CDA. Chairperson, my concern in slide 11, the 4 key insights provided, I would like to pay particular attention on key insight number 4. Dealing with cannabis and alcohol. I am sure we will agree that there are many negative attributes related or associated to cannabis and alcohol abuse, as outlined in slide number. Chairperson, secondly, on slide number 12, is talking about the trafficking of illicit drugs. Listed there, does South Africa have the proper infrastructure and equipment in place to detect those drugs from individuals and their luggages when they entering and leaving the country, be it at airports, harbors, or borders control points? Because at the end of the day, it will to fight against the unprecedented stage of an overflow of their illicit drugs. And Chairperson, when it comes there, our department is all over the country. Ngesingenazo those scandals zomanyobeni, because there are many issues in South Africa as bangelwa drugs and also utshwala. And lastly, Chairperson, on slide 13, I have a concern about the South African situation analysis on tobacco. Following the ban of tobacco advertising in this country, and this question relates to the effectiveness of the regulations imposed on tobacco and the consequences thereof. Did this entity track whether such a ban on tobacco products, or whether the results when that big tobacco brands eventually lost their market share as cheap tobacco products gained prominence? Mandime Appa, Chairperson, I thank you.
Thanks, Honorable Tafeni. Honorable Abrams.
Thank you, Chairperson, and thank you for the presentation. It was comprehensive and therefore answered many questions. Chairperson, the issue of budget has been well ventilated, and I do think we're going to be continually be having this this debate on budget as the financial pie gets smaller and smaller. And I mean, even that 1.2 billion that the department is spending on substance abuse, I mean, there are many NGOs that you still have to factor in that money, and I mean, their budgets are also getting smaller and smaller, and NGOs are they are, because of that, you know, they're rendering less and less services. Then, Chairperson, I do feel that when it comes to this matter, political will needs some bolstering, in that without the political will from the Minister and the DM on the issue of substance abuse, it trickles down to the provinces and the municipalities. And I do believe that if the Minister and the Executive takes this issue head on, that political will can hopefully trickle down to the provinces and to the municipalities, in that they can have improved coordination and cooperation between all the departments, the provinces and the municipalities. And the one thing I did pick up from the presentation, Chairperson, is that where you see more functioning ALDACs and provincial secretaries, CDA secretaries, their reporting seems a lot more comprehensive than where you find that they are non-functioning ALDACs, because as we know, these issues need to come from the ground up. The communities need to be capacitated to solve their own localized issues, which are unique to them. Then, Chairperson, you know, the phrase, the war on drugs, I think that phrase has, the war of drugs, it's lost. It's been lost worldwide, and that is why I appreciate the adoption of, you know, the whole of society approach to tackle the drugs, which is in the presentation. And the whole of society includes government's role, it includes the CSO's role, but also it includes the parents and the family's role that they have to play. And we can never ever take away the parents' responsibilities that they have to play in their children and their families and in their homes. And then lastly, Chairperson, much has been said about medical and commercial cannabis industries. And I do believe that would have been properly ventilated when, there's another Justice Department, when they were busy with the legalization and those laws that went into these industries. And I just would like to find out, and this is the only question I have, is has the CDA done any research? And I know research is also now underfunded and problematic, but is there any then evidence-based reports that maybe now contradicts the position that there are more harmful effects to the legalization of the cannabis and the cannabis industry, and going further, you know, the hemp industry, because they make bricks and fabrics and all these things, and more harm than good. And when I say good, I'm talking about the economic good that it brings into our country, because as we debate SONA, we hear that our government's apex priority is jobs and economic growth. So I just would like to find out, is there some evidence reporting done there between the harms and the goods that's being done? Because I do believe, Chairperson, that the more young people and people we have in jobs, even if it's now through the cannabis industry, the less we'll have young people sitting on street corners, unemployed, involved in drugs. And from my perspective, you know, we ask the question, why does it feel like we're losing, why do we feel like drug abuse is becoming worse and worse over time and not getting better? And from my perspective, it's getting worse and worse because more people are unemployed. And we have young people that have a degree in hand, but they don't have a job, and nothing brings more hope and dignity to a person than a job. So thank you, Chairperson.
Thank you so much, honourable members, for these issues that you've raised, which I believe need attention, and they actually need a response. I have a challenge. I will not outsource my challenge to you. It's mine. And that challenge is this. We have just come to exactly a minute after the time allocated for the deliberations. And my sense, having listened to the questions and the comments, is that we need time for you to get back to respond now to the honourable members. And I would like to put this over to the honourable members. How is it, because they were taking notes, how is it, should we consider asking the Central Drug Authority coming back to us in writing with our comments, or did you want to ventilate it? Because we're totally running out of time. It is Wednesday today. Normally we would have a sitting at 3, but we are having it at 2. So that is another complication that comes in terms of our time as a committee. So, Honourable Munyai.
Oh, thank you for the opportunity. I would appreciate that, to save them the money they don't have, not to fly to Cape Town and respond in writing. Thank you.
Okay. Honourable members, is that position Seconded. I don't know how you feel, Chairperson. What is your take?
Thank you very much, Chair. I think we should agree with your proposal that has been seconded, that you should respond in writing, because indeed you've been taking notes of what the members have been actually indicating to us. Thank you, Chair. Maybe you can give us a time frame.
Well, is by Friday this week? Is that fine? Because I also gathered from the questions and the comments that were made that there were also issues of clarifying what was in the presentation already. So you can just refer us to where you were dealing with the issues that were being asked by honourable members. And I thank you for your understanding. So, thank you also, honourable members, for agreeing to this, because I do believe that you need the information that you asked, or just the comment on the issues that you raised. I then want to go straight into the second briefing on the systems to track social grant beneficiaries who wrote and passed matric. I will hand over to the department. Thanks. CDA, you are very welcome to stay with us or not stay with us, but I will leave that in your hands. Thank you so much.
Thank you, Chairperson. Good afternoon.
Did the Honourable Deputy Minister want to say something?
Yes,
on this?
Honourable Chair and
Sure.
members of the Portfolio Committee of Social Development, the DSD Executive, the Acting DDG, Mrs. Lumka Oliphant, and colleagues, ladies and gentlemen, I was quite happy to have heard the positive results that the class of 2024 produced. I hope that it will inspire the class of 2025, as I indicated in my debate yesterday on SONA, what I hope that better results will be produced at the end of this year. You cannot expect people to pass their matric exams if they don't have a nice, nutritious meal to sustain them while they study and when they write. And nearly 3/4 of the matriculants would have been in that position if it were not for the grants that they receive from government. So I'm pleased with the report shared by those who analyze the statistics and provide us with fair insight into the overall results of the class of 2024. In this regard, the business intelligence presentation contained data information extracted from various institutions, structures that includes SASSA, NSC Data, Home Affairs, NSFAS, and Department of Justice, that is data, children in conflict with the law. It should be stated that the administrative data highlights the country's digital transformation strategy. That's why I can't accept a view of honourable member that there should be no online SASSA applications. We must move with the times. We can't live in the Stone Age. The purpose is to improve services for all vulnerable children and also to address inequality and intergenerational poverty. The presentation does, however, not only focus on the cash aspects of grants, but it also includes DSD programs such as RISIA that are delivered at the community level. It is one that aims to improve child well-being. The data presented outlined the educational performance of SGB, whereby 81% of grade 12 of the class of 2024 were social grant beneficiaries and many children receiving child support grant. The data was disaggregated into provincial pass rates, grant type and grant status, active or inactive, gender, that is the girl child academically is doing well. We must not ignore the boy child, but that's another story because we have appointed a boy child parliament. Age congruent, children in conflict with the law, RISIA and NSFAS funding status. It is my view that the department has done well. Chair, what they're going to present to you will blow your mind. And I recommend that more business intelligence projection work on pass rates and children obtaining NSFAS should be done. I need to stress the importance of the family program in building stronger communities. Chair, I mentioned yesterday in my debate in the sauna that government invests more than 200 billion rand when it comes to social grants, and it is the biggest. I don't think any other department except paying off our interest debt gets more money. So we need to know that it is money well spent. But more important, we need to do something about making sure that we have a class of 225 that we can be proud of to show that the nation is moving in the right direction. We cannot have Bantu education in 225 and the results of Bantu education in 225. We've seen in the class of 2024 how many children are flourishing and doing very well and have been given opportunities and have been given food to eat to assist them in the academic results. So I thank you, Chairperson, and we look forward to this report, which is going to blow your mind. Thank you very much.
Thank you, Honourable Deputy Minister. Our minds are waiting to be blown. Over to you.
Thank you very much, Chairperson, and also to the DM for the beautiful words in anticipation of this data that we're about to present. The department since 2015 has tried to make sure that we use technology to make sure that we protect and also trace our children who are in school, and with the hope that we will realize what is called NSPIS for us to be able to protect the children of this country and be able to make sure that we account for where our children are and what they are doing. The grade 12 results are a barometer for us to be able to see whether we are realizing our educational outcomes of the country and also in the protection of children. We have been working with various departments, the Department of Basic Education, we're working with SASA, working with NSFAS in order for us to be able to give a start to the grade 12 that is now becoming an adult. If you remember that the Department of Social Development looks after children, but we have to make sure that as they go into adulthood, they have a little bit of a start, and the children that were on the social grants are automatically into NSFAS and be able to get that start. We will also be able to give you that connection with us, and I think the DM has also spoken about the issues of children in conflict with the law. When we look at this data, we are able to then to analyze and be able to see what are the crimes our children are committing, and also if our programs, when we rehabilitate them, are they working, and whether they're writing and passing matric. So this is about data that is also going to be important for policy development, a shift in the country, and also making sure that we see where we need to strengthen our campaigns and also give insights for planning purposes. I'll ask my colleague Osborne to take us through the
to the presentation. Thanks. It is a live demonstration because it's a systems presentation. Thanks.
Thank you so much, Chair. The presentation in front of the House is constituting of data sets that are coming from DBE, Basic Education, for the year of, or the class of 2024, overlaid to the SASSA SOCPEN data sets, which is the system that we used at SASSA to pay out grants. We also overlaid it to our social development systems for programs like RESIA and probation management. We then also overlaid that information to the NSFAS for the granting of grants. So what you are seeing in your screen ultimately will then give you the results. We are concentrating both on full-time students and part-time students. The Department of Education on the 10th was only giving us the full-time students' results. But on our base, we are concentrating both on full-time students and part-time students that are receiving grants and would have written grade 12 for the class of 2024. Looking at the first part of the data set is the Department of Education when registering the students. Last year, they gave us a database that says 882,000 or over 882,000 of children registered for the class of 2024. Those children were both those that are receiving grants and those that are not receiving grants. So this is the total class of 2024. The male was at 42% for this particular class, and the female was at 58%. So the girl child was more than the boy child in this particular class. From a full-time or part-time perspective, most of the students here were students that are going to school on a daily basis at 82%. The immigrant child only formulated 1% of the class of 2024. Now, because it's a live demonstration, we could be in a position from this to even just drill down on the information and say, if we wanted to see the male child, where is this immigrant child coming from? Sorry. Sometimes technology will do things like that to you. So I'm looking for a way to drill it down, and it's not doing that. Okay, it does not want to. Maybe it's the network. Okay, let me continue then. So there's a possibility, or that we've designed it in such a way that it drills down. I'll do it as the presentation is going down. So the repeater child, which is at some stage you'd find that the child would have been in grade 12. I think it's the network from the room. At some stage, the child would have been in grade 12. Sorry, but I need to make sure that I'm connected to the internet. There's the problem, I'm not connected. There's the problem, I'm not connected, sorry. Sorry so much to the house. Yes, now I'm connected. It's coming. Technology does do this, Chair, to the best of us also. So for an example, Chair, if we wanted to look at the immigrant child, hey, this is witchcraft. Okay, let's look at the child that would be a repeater. The dark color is saying yes. So most of our child that were repeating grade 12 would come in from these three provinces. It would have been Gauteng, Limpopo came second, and then KwaZulu-Natal came in third. So those were the repeaters. It means at some stage in their lives, these children would have attempted to do grade 12, but they did not succeed, and they came back in the class of 2024. We then took time and say, let's integrate this information that DBE is giving us with the data sets that are coming in from SASSA. And then the story that we drew up from this particular engagement or laying was that out of the 882,000, 697,502 were SASSA beneficiaries, which constituted 79% of the total class of 2024. 79% of it was children that would have been receiving grants. Most of the grants that we're receiving were child support grants at 94%. That 697,000, 94% of it would have been receiving child support grant. It would mean that they would have started early in their lives to receive those particular grants. Because child support, you can get born now, you register, and then you get child support grant. It's not like foster care, where situations do change as you grow up and then you then have to apply for foster care. But child support grant, you can get it immediately. So what we also found was that from that 697,000, full-time students that were SASSA beneficiaries constituted 586,000, and those that were going to school part-time were about 111,000. The girl child was also a major part of this particular base at 59%. At the time when they were registering to write grade 12, the child support grant was for the children, about 448,000 of them were still in payment for that particular 697,000. They were still in payment for child support grant. And about 204,000, they had already lapsed for the child support grant as they were entering into the room to write the exams. So the age is also the factor in this, because 53% of this class, or this 697, would have been in the right age of 17 and 18. But 45%, or let's say 45%, yes, would have been 19 and above, and that would influence also the qualification to get the CSG or any other grant thereof. Yes. So the age, as you can see there in that slides, when we talk about age group, that's where you get your age coming in. So we are always okay. There it responds now. So if you wanted to look at this 17, technology. Yes. Let me leave it. So we then said, no, let's then run this data set of this 697,000 of children that are going to write, that are receiving grants against our programs within the department. We started with RESIA. RESIA is a community development program that gives psychosocial support to children that are in school. We found that out of that, 1,511 beneficiaries were writing grade 12 of RESIA, and fortunately enough, about 649 of them would have applied to continue a higher education using NSFAS at that particular time. The girl child still represented a larger margin. The 17 and 18 age group still represented a larger margin. And yes, they were still in payment in terms of the child support and foster care grant at that particular time. So we saw children that would have had challenges at home in this particular class that were getting psychosocial support coming in and writing grade 12 to those amounts. We went a step further and said, were they in conflict with the law sometime in their life, and they did manage against all odds to then be in grade 12. Then we looked at the probation case management system linking to that 697,000. 1,069 of these children, sometime in their life, would have been in conflict with the law. And out of that, 278 did manage to get to grade 12 and apply for NSFAS funding. What kind of offenses were they actually committing? Mostly it would have been violent offenses that they committed at 96%. And when you look and drill down to the offenses themselves, I tried to make a list. It would have been assault, rape, stealing, murder, property crime, robbery. This information comes straight from the South African Police Service when a child is being arrested that particular case gets to be given to us through an automated system to say we've arrested a child, they must not sleep here. Send the probation officer to come and take the child so that this can actually secure the rights of the child. So these are some of the things that the children of the class of 2024 were committing sometime in their life, but they managed to get to grade 12. Now, looking at our remedial action for this particular class, for the children that they would have committed crime, most of the children would have been placed under home-based supervision for this particular class. So it means that that particular mechanism worked for them to actually get to grade 12. Secondly, they would have been put into guardianship, a larger portion. Just a small portion of about 2.3% were put into secure care centers. Then we looked at the grant, whether they were active at that time when they were actually writing or registering for grade 12. Yes, the child support grant was still active for most of them, but a bit of them would have been inactive. Then we went a step further and said, let's look at the NSFAS. For that 697,000, we found 272 that would have applied for NSFAS grant. And fortunately enough, a larger chunk would have been approved already to be accepted, which is about 261,000 children that would have been approved by NSFAS. Then we also looked at their age. The 17 and 18 is actually performing very well for this particular class. Those are the children that are ready to just get into higher education. Yes. Then the result sets, we then ran the result sets, I think, on the 10th of January to say, now, for that 697,000, what would have been the results for this particular class? How did they perform? $697 applied to write the exam, but only 673,190 actually wrote for this particular class. So the difference between 697 and 673, it's children that did not get to write the exam but were in grade 12 at that particular time. It means that we still need to find them within our data sets as government to say what happened to that particular deficit. Then the total tally of children who wrote grade 12 would have now moved from registration at 79% to those who then wrote at 76%. Then that means the 3% has gone away. Where is the 3%? It's a question. How do we trace the 3%? Were they in hospital? Were they in mortuaries? Where were they? Then out of that 673,000, 489,103 achieved to pass the class of 2024, and about 184,000 did not achieve. So you ask yourself, on top of the 3% that did not write, that were receiving grant, we're adding another 184,000 that did not achieve. That would probably be coming back on second chance programs from Department of Education. The girl child was still strong even at the results in terms of 57%, and then 43% for the boy child. This is where it becomes much more interesting. This class, which was receiving mostly grants, they got 51% bachelors. At 253,000 of them would be eligible to get into university and study for degrees in universities. For those that would study diplomas, at 32%. And for those that would study higher certificate, it's at 15%. We then ended up with a conclusion that the class of 2024 had a 72 pass rate for the children that were receiving social grants and a 28% failure rate or unsuccessful rates. From that particular 489,103, 224,942 would have applied for NSFAS, and they are ready to be then accepted into higher education. This is what we do then, Chair. We then provide that particular list to NSFAS so that they can actually make sure that they communicate with higher education so that they say these people must be priority because they are coming from us as government. Largely, it's the black race for that 489 at 93%. The age group still says 78%, followed by the 17 to 18 age group are largely at 65%. The 19 and above are largely at 34%. So you are seeing this particular age group that is 19 and above also performing very well. And what is nice about it, you can also just say for the 19 and above, because there's the magic I was talking about. When you click on one bar, it actually changes the entire thing to talk to how many bachelors did that particular category, the 19 and above. You can see there that they've got 61,000 bachelors. You know, diplomas at 66,000. So that is what is nice about this. Largely, they were still in payment at 72% when they were actually writing the exams. And mostly it was the child support grant that they were actually getting. But you proceed, therefore, and say, where are they coming from? What type of schools are these children, the 697, coming from? And from the quintile perspective from education, you'll see that quintile 1, 2, and 3 are contributing a larger portion of these particular children, the 489,000 that achieved. But you still have children that are coming from quintile 4 and quintile 5 schools that we are paying grants and are actually achieving. Those are then the achievements from that, and then the registration. You can see that this one, full-time is at 99%. For the 489,000. Mostly it's public schools than the independent schools. Mostly it's ordinary schools at 99%, and the grant still remains the same at 72% for this particular class. We then looked at the results versus NSFAS. We wanted to go deeper into the results versus NSFAS. For the 224 that applied, about 218 of them had already been approved to say you are just waiting for the results, otherwise you are approved to get into university. Now, we need to then look at capacities and all those things as we go on. Then we went a step further to say, from the 1,069 that were in conflict with the law, how many wrote and how many passed? Only the ones that were in conflict with the law. 1,038 managed to write. So even here, from 38 to 69, that particular few tens or 20s, they did not write. Where are they? And then 737 achieved. And you can see that in their achievement, mostly at 39%, these children, although they were actually in conflict with the law sometime in their life, 39% got bachelors. It means that they are going to universities. We then looked at also the RESIA program. 1,511 registered, but 384 wrote. Where's the rest? Where's the rest? How can we track that particular rest? 1,194 achieved, largely also 49% for bachelors, the ones that were involved in the RESIA program. We then said, internally within our systems, what are we looking at for this particular class? How many would have walked into social development programs or even service offices and needed help? 1,964 were found on our system, and from that, 1,158 did achieve, and that is the achievement. But what were they doing at social development? 21 of them would have came in for adoption services. So we've got about 21 children that were the part of the class that were adopted. 45 would have been abused at some stage and came in for child protection under the Child Protection Register. About 6 of them would have been profiled when we were going to communities and profiling households and communities. 1,044 would have been in conflict with the law, the ones that are found on that the achieved one, which is 1,158. 1,044 of them would have came in for PCM. Then 33 of them would have came in for victim empowerment. It means at some stage they would have been abused, or the mother would have been abused, and then they would have undergone the victim empowerment programs. But this is the story that we're still continuing to build. With more data sets, we could be in a position to tell whether they did apply and were accepted for varsity, but those data sets are not available. We are also interested in knowing whether they will be part and parcel of the job market in the future, but that is why we're driving for an integrated system within the sector, so that we are able to tell a fully fledged story and not only trace a particular class, but trace the entire child in South Africa. Thank you, Chair.
My mind is blown. I have to confess. No, this is amazing. For me, it's you know, when we say that we want to see the best interest of a child being paramount in everything that we do, this is making a contribution towards that, and it has to be commended. And I take it in my mind, whilst it was busy being blown, I take it all you use is an ID number?
Yes, Chair.
Of the child?
Of the child, Chair.
Okay.
Yes.
All right. Okay, honorable members, here is the information that is very exciting for me. So are we saying that those children that are lost, that fell between the cracks, at this point in time, we don't know where they are?
We don't know, Chair, to be honest. We do not want to. Yes.
Yeah. And the other thing, there was a time, I think it was last year, when we were saying the government must look, or the department must look at ensuring that the children that turn 18 before they finish school must be supported. Because, I mean, this system is allowing that. You are able to say, we know that the law says at 18 you must not get a grant, but since we do have information, evidence that you are still in the school program, you can then get your grant. Because those children, some of them, maybe the ones that have fallen off, are the children that did not have the means to continue. And even the 350 rand, they couldn't get it for some reason. And so, yeah, but it was worth this time. Honorable members, please go ahead. It looks like, can I just start from my side? Honorable Mhlongo, Honorable James, Honorable, Reverend, Honorable Abrams, Mare, and Tafeni, and Honorable Munyai.
Thank you, Chair. Now that you are blown out of your mind, Chair, you now are making me feel somehow. But then, Chair, one of your questions have covered me, that in as much as a person is 18, the grant stops, but we have proof that you are 18 and you are in matric. The department should look into that. Secondly, Chair, in as much as this presentation is blowing our minds, Chair, these are SASSA beneficiaries. My concern is that they still have to go to NSFAS and prove that they are SASSA beneficiaries. Why don't we have a system that gets them? They still have to come to NSFAS with proof that my mother gets grant and don't. But this person has went to a quintile 1 school from grade 1. But still, when they get to tertiary level and apply for NSFAS, they still have to prove themselves as being SASSA beneficiaries. SASSA should look into that they do not have to prove themselves, because you started from grade 1. I mean, why must you now get to NSFAS and have to prove yourself? And also, the missing ones, we can't just say they're missing. Where are they? And it should concern us that we don't know Gutsibagupi, Bendani. So I think we should also be concerned about those that are not here. But apart from that, Chair, Ngiyema lapho.
Honorable James.
Thank you so much, Chair. I promise to look at you. I just want to ask how accurate is the presentation in terms of the numbers, especially when we speak about children in conflict with the law. Especially since we know that our regional sort of structures when it comes to the education department does not report effectively when it comes to the school safety program. So I want to ask also, were you in contact with the courts? Because this is where most of those learners will be filtered through, children in contact with the courts, as well as obviously your department that has a designated section that deals with children in conflict with the law. Thank you.
Thanks, Honorable James. Honorable Mahato.
I just want to say this year at least they worked very much hard. The results just 2024, we just want to say thank you. I don't want to say anything.
Another mind blown. Honorable Reverend Kobaza.
Thank you, Chair, and thank you for the presentation. Really, it's mind-blowing. And then I fail to think after, because my mind is blown, and I think that is what is happening to the department. You blow their mind, and after that, they fail to think what to do, because when this child is getting a grant, that grant does not assist the child only in that particular home, but it assists everyone. And then now it's after matric, after he or she is 18. Now, what happened to this family now? Not getting this grant of this child? And what will happen to this social development now? After this data that we have, it's just troubling me how these people are living after this now, without this grant now, after matric. Maybe it's for the department itself, not for the data analysis themselves. But also, there's immigrants, and why we have 1%, it's because they don't have IDs, but they get to grade 12. A number of schools, they occupy over 50% in those schools. And they eat with the children of South Africa, should I say, and they get all the benefits. But when they get to matric, you will not get them there because they don't have IDs. But they are in schools, and they hold at least 50% in some of the schools. Some of the schools, 70%. So you must get them even they are not documented, because they are there. The challenge is also, what about there are a number of children that do not have IDs. And it means that those ones, we can't capture them. I don't know how we're going to deal with that also, because it's part of the whole data on what we must do. I think, Chair, that I'll stop on those ones because, but the mind is blown, really, you know, and how is this family is going to live after this, and what is the intervention that the department is doing after this. Thank you so much.
Thanks, Honorable Reverend Kobaza. Honorable, was it Abrams? Okay.
Thank you, Chairperson, and thank you for the presentation. Chairperson, it's very happy to hear that we're all now on the same page, that those are 18 years old and still in school need to be supported. It's something that I've been harping on every meeting. And then I get told, but there is the SRD grant that these children are supposed to apply for. But if I do my maths, chairperson, in the Word document report that we got, 0.46% of the learners whose grants are inactive have an active SRD grant. 0.46%. So the solution for these learners is not the SRD grant, and I'm not going to get into the SRD grant and all of those allegations because we have a presentation later on in our program for that. So I'm very happy to hear that there's some common understanding there. With the children that are now missing, that we don't know, and I mean those children are really the ones that we should look for, because they're not in school, which means they're not receiving their one meal at their school. The teachers don't have sight of them to report if there's cases of abuse. You know, they're not in any education, and they're not in a place of safety to some degree. And those are really the children that we need to find. So my question then is, if DBE has attendance registers and you have contact details for these parents, how then is it so difficult to track these children? If they can say this child has not been in school for X number of days or weeks or whatever, and they have an ID number and you have an ID number and you have a home address, how is it so difficult to track these children? Because these are the children that really need to be referred to our social workers to be doing a home visit to find out what is going on. Then, Chairperson, I also then just want to say that then there's a large number of children who with inactive grant who are making it and actually passing matric without the support of DSD. And those children really need to be commended for actually sticking the course and going through. But then also that there are then children in grade 10 and 11 and maybe even younger who are also making it through schooling without the support of the department. Then, Chairperson, I did some math, and hopefully we can exchange numbers so that we can double check my math. But if the expenditure that government is spending from grade 1 to 12 for child support grant learners is 58 billion. I mean, I put it that it would just be another 1.3 billion to extend the child support grant to these learners if, hypothetically speaking, all of these learners turn 18 in January, which is not the case, so therefore it's a lot less. So I do want to ask the department if they can please go back and crunch some numbers to what would it then cost to extend the grant to these learners, because as you said, there's a number of learners now, 184,000 who need to repeat matric, and they are now likely over age. So there we already have a number that can be worked with that needs to be supported. Then, Chairperson, I'd just like to find out the 9,253 foster care grants that lapsed while they sat down for matric. Was that because now they're older than 21? Because my understanding is that the grant is not supposed to stop unless they are older than 21. So just to clarify that. But then also a question. On the Word document, it said that the total inactive, that's inactive enrollments. So the inactive enrollments that is at 420,000, is that different to the number of grants that lapsed when they sat for the exam? So enrollments, I mean, did they enroll for the matric and therefore sat for the matric, or is it two different numbers? Because it's almost half. So I just need some clarity on the two numbers. And then lastly, Chairperson, the children that are in secure CYCCs, where are their grants being paid? Who are their grants being paid to? Because if the state is securing them housing and meals and toiletries and all their necessities, who and what is their grants being used for, and where are their grants going? Thank you, Chairperson, that's all.
Thank you, Honourable Abrams. I didn't hear that whether you did say that your mind is blown or not.
Chairperson, my mind is blown if they can give me access to this platform.
Okay. Some minds are very difficult to blow. You will understand. Honorable Marais.
Thank you so much, Chairperson. I just want to know from the department, I've been to a school the beginning of the year, Rosenhof, in Bloemfontein. It's a very special school. It's the only school in the whole of South Africa. And this school is maintaining girls, and the boys one is in the Wetsdorp. These children are the ones that had committed crimes, that had been through the court has sent them there. But the school's concern is that as soon as the children come there, social development takes their money away. They don't give the money anymore because government is maintaining these children. But the principal is telling me that these children need toiletries, they need all those things because these children don't go home. They don't go anywhere. School staff stays on the premises, there's hostels and everything. They are there 24/7. It's a special school. So they said if they can get the assistance of social development, because even the matric ball dresses, they had to make by themselves. They get some places like Pick and Pay and Shoppers and those places to give them a donation with foods and what. And this school is doing excellent with sports, dancing and all these things. They got all these things in the cabinet there showing how good the school are doing. And the reason why she's saying that because some of the classes got 2 or 3 children in. But because some of them are very violent, they come from different rape cases and things. So they need special attention. But the funding of the school has been taken away because of the school, like they're not in a normal school where they go the beginning of the year. I have 1,000 children. The children comes in drips and drabs during the year, but the budget is not made for it. But the question that the principal asked me, she said that social development is completely out of the equation. So if the amount of children that has dropped out, maybe during grade 10, the child went to that school. So they can't pick him up because he's not getting the money anymore. The social grant has been taken away from that child. And the principal is saying to me, if they can just assist by giving the children that money so that they can go buy, because the school must buy clothes, they must buy underwear, they must buy everything, and the budget is very small. That is the school of Rosenau is the school's name, and the boys is in the Wetsdorp. Jimmy Roos is the school's name in the Wetsdorp. And they have the same problem because those children, the boys there, also go through the system of justice to get there. They can't just be taken there by anyone. So maybe that is the reason why some of your things, the children are falling away because they are in that system. My concern that I have is that the children of 18 years old, like I said to you last year, of the people that told me that the child is only grade 10 now, but the child is 18 January. So that child is not going to get money. And this child is staying with the grandmothers because the mothers are highly on drugs. The children is not going to get SASSA grants anymore. That is a huge concern. The same with the foster care children. 18 years old, they're not finished with matric. A lot of parents put the children out because they're not getting money anymore. That is a concern because what must a child do? Like I said last year, in this very same place here, I said that the Department of Home Affairs and Social Development must work together. For the first time in the Eastern Cape last year, they made their target because the Department of Social Development and Home Affairs work together. The child is born at the hospital, registers the child, gets a grant for the child, and the child go home. Because in the rural areas, you can't see the child for 3 months or whatever months. The child is not exposed to anyone because it cannot be seen. And then for that parent to travel all the way back to town to go register the child, the people don't have money. So that is where a lot of children only get grant when they're 5, 6, 7 years old because the child must go to school. But for that period from 1 to 5 years old, the Eastern Cape never made a target. But last year, for the first time, I did oversight, and they were telling me in Grahamstown, for the first time, we are making a target because we are working hand in hand with Department of Education, Department of Health, and Department of Home Affairs. Thank you, Chairperson.
Thank you, Honourable Marais. Honourable Tafen.
Thank you, Chairperson. Damkele report. The first member is covering me about the system because as you register the child on the time that are coming out from the hospital, why kufuneka as ne documents again? As was chaza ku Department of Education. And in light of this newfound relationship between the department and the NSFAS, would the sharing of information between these two organs of state make it easy for a grant beneficiary to be processed and approved by NSFAS as solely on the basis that they are grant beneficiaries? Meaning that this on its own should be proof enough that they are in financial need without having to prove the financial income on an absent parent who they do not know their whereabouts. In short, does it always follow that a grant beneficiary's application will be processed much quicker and approved by NSFAS since the affordability assessment is out of the question? I thank you, Chairperson.
Thank you, Honorable Tafeni. Honorable Mnyai.
Thank you, Chairperson. Firstly, the SASSA is the backbone of social development to alleviate poverty, inequality, hunger, and unemployment. And I think this is the basis in which Deputy Minister, the ministry should expedite the introduction of the universal basic income grant. That's a basic statement. I'm saying relative to the impact in which it makes even to the learners that pass matric as outlined. The basic question, which system is this and when it was developed? If that could be clarified, which part of the ecosystem is the system integrated? Or it is a simple app that you'll be able to go live when you are connected to the internet? That should be clarified. What impact that you have recorded as a consequences of the system integration? What are the preventative intervention, Honorable Chair, that are in place at DSD, making sure that no one is left behind, as I saw the sign in the presentation of the various government departments? How do you account, Honorable Chair, on the children that cannot be found in any data set? These are children, in my view, that are not at school, not receiving any grant, staying in some remote rural area without parents. And that should be the main critical concern at the DSD, as the children are more vulnerable, exposed to more unprecedented risk at these remote areas. Lastly, you know, when you come to demonstrate a life system, you must pound to pound have a data. I went through the notes of the Word document. It's not aligned with the presentation by all number of slides that you have presented. It's important to have a backup of practical notes that talk to each slide. Or you can get the developers to improve. While you are talking to that slide, the notes on the left side, blank page beyond the data, could be reflective, so that even if the system could have a glitch, the notes will be there for you to interpret and shared with the people that are this audience, your audience, as you present, rather than speaking for something that's, you know, here but not shared live with ourselves as the audience. I thank you, Chair.
Thank you, Honorable Munyai. That would be all from the honorable members. I will hand over back to the DDG Acting DDG.
Thank you, Chairperson. On the acting DDG, Chairperson, we're hoping that by the time we come back, we will have a better executive because those are on the way to cabinet. Just on a lighter note, I want to assure Honourable Mhlongo that the reason we are integrated with NSFAS is precisely for the reason that we do not want the child who is in the who is in the grant to go back and at NSFAS and start again, which is why we can be able to give you at this point that how many children who were on the grant have been accepted by NSFAS. It's what the presentation is saying. Maybe it didn't come out clearly as it should have been, but the numbers that we are giving you are children who have been accepted at NSFAS for them to be able to get into tertiary institutions. If they have passed, they've been accepted, they will be able to get their NSFAS without having to start from the beginning. Most questions were also just about policy, which is why we brought this presentation here, is that we must start thinking about how are we going to now change policy if we need to change policy, because the honourable members are saying that a child, when they turn 18, some others are still in school. What are we going to be doing about that? Are we saying we need to change the age of maturity of the country? Are we saying that we need to amend the Social Assistance Act? This is why this presentation is here, so that we can be able to assist one another in making sure that we move ahead with the things that we need to do and be able to account for the children of the country. Yes, Honourable the Reverend there, we understand the issues of children who are migrant children who are in this country. Most of them are in our child and youth care centres. They are writing matric, as you are hearing here. They are in our schools, but we still need to get other departments like Home Affairs to make sure that these children are registered. I want to implore you, honourable members, to go to our platform DSD TV, because we've got documentaries that we've done about these children and the things that they are unable to get from other departments. The reason that we want to push and advocate for NSPIS, honourable members, is for us to be able to have this data that you want, that when a child passes grade 12, what is going to happen to them when they get to grade 12, up to the time they are able to stand on their feet. This is why when we say that our systems need to be integrated, we want to be able to account for the children, protect the children, make sure that our children are in schools. Maybe another thing that we are asking for from the honourable members is that we need to start thinking about what are the campaigns that we need to have. Do we now need to start making sure that we'll slightly concentrate on the boy so that the boy can be able to be staying in school, not committing crime, and be able to get to where they need to be? Because if we're not looking at the boy child, it means that we will not be able to deal with gender-based violence and femicide, because our children are committing heinous crimes at the very young age. So with this data, this is the conversation that we are wanting the members of Parliament to also assist us in terms of where do we go to, where are the parts that we need to make sure that we strengthen with the help of other departments. Imagine, Chairperson, if we had the data sets from the Department of Health. It means that we're able to tell you that the child, all of them were vaccinated, for instance. We will be able to tell you how many of the children were pregnant, how many of the children went back to school. This is the question that we need to be answering as a country, because we now are starting to have the data that tells us what we need to do, where we need to go, and who is supposed to come to the party. We're supposed to tell you how many children who had died when they were writing their matric examinations. We are working with Home Affairs. We need to maybe improve on this system so that we can be able to give you a full picture, but without other departments coming in and making sure that they are part of this, we will not be able to give you a full picture. I think the intent of the department is to protect the child and make sure that we are able to account for every child in the country. But I think I'll give to my colleague about the actual system and when it started and all those nitty-gritties. Thank you very much, Chairperson.
Thank you, Chair. The system is a business intelligence tool supported by Microsoft platform. It's called Power BI. It takes data sets from different sources and then formulate an analysis out of it. We are trying to make it dynamic so that it can connect directly to DBE, connect directly to SASA, and connect directly to NSFAS so that we do not have to import data sets at the moment. The data sets that are here are imported so that we can formulate a system. The dynamic will come in 2025. But as we go along, we'll include more transactional systems like health, justice, and other platforms within this piece so that we can get a real-time experience and information that comes regarding a particular subject. Here, we're just talking about a class of 2024, which is a child that was in grade 12. But if we talk to their system as DBE, we will be in a position to even do projections to say these are the number of children that are in social assistance from grade R up until grade 12. These are the analysis or preemptive analysis that we are seeing that might emanate from that particular class. This is a total investment that we're predicting for the next coming 18 years for the country. So those are some of the things that we will be able to predict so that even government is able to then look at their commitment to say this is how much we'll need in that particular year for this particular class.
Okay. I think Honorable Mnyai.
All I was saying that it's a recommendation respectfully to you, Chair, that can they respond in written form so that they don't miss out all the questions that we've asked on record so that we get all the details.
Yeah.
Thank you.
You did take notes and you will. That'll be great. That'll be super. But I do need to bring the meeting to a close. I don't know if the DM wants to say 1 or 1.5 words.
Yes, thank you, Honourable Chair. I want to clear up the issue about the 18-year-olds more directly. I sat down with the Minister of Higher Education. You know, in the government of national unity, there's no silos. Sat her down, I told her, explain to me what happens if I pass matric and I'm a SASA grant beneficiary. She told me you obviously have to apply to university. If they accept you, your ID number triggers a code and you automatically get a NSFAS grant. So the system is already seamless, and I complimented the Minister of Higher Education for putting that in place. So I've been going around the last 3 months telling those who are getting grants, their parents, please apply to the university or college because your grant is automatic. There's no forms to fill in, there's no applications to make, there's no 3 months bank statements like honourable members have been stating. I'm disappointed that our communications department are not communicating properly to tell social grant beneficiaries and their parents, please apply to go to university. With regard to those who don't get entry into university, the department has a sustainable livelihood program to migrate them from being 18-year-olds that don't have the aptitude or that hasn't applied for university to move into sustainable jobs. So my outreach officers are already connecting with those that are involved in skills development to try and absorb them and to put them into sustainable livelihoods. Honourable Chair, you know that in terms of the National Development Plan, by 2030, we must eradicate poverty. So those who are between 18 and 59, remember we look after the 60-year-olds in a different way, and I'll come to that in a second. So those between 18 and 59, by 2030, they should, no one should have less than 760 Rand in their pocket every month. So that is one of the goals of the National Development Plan. The Chief Whip mentioned the basic income grant and wants me to prod the president to announce something positive about it. That is on the radar, that the SRD grant will form the foundation of a basic income grant, but that is still at cabinet level. I don't serve in cabinet, so I can't give you the information. So there is light at the end of the tunnel for 18-year-olds. First of all, they get the automatic NSFAS funding. Those who fall through the cracks, the department is looking at sustainable livelihoods, and then we have this basic income grant. Once you reach the age of 60, instead of getting a birthday card, you should get a SASSA card. You shouldn't go stand in queues and apply for it. And I'm sure we can find a way around it, because President has said we're moving into a digital economy, we're moving into a digital environment. So we just have to get used to online digital technology, because it's impossible for SASSA to have enough officers, to have enough staff to service 28 million people. That will take away most of the budget that government can afford to give for this type of thing. So we have to look at cybersecurity, which is a challenge. And I mean, this portfolio committee has been working closely with us to try and sort out the issue of cybersecurity. We need to look at financial inclusion. The Postnet doesn't have any premises, any offices. It is online. And people are silly if they're still with Postnet. They should go to banks that have branches that they can go to, because not everyone, like the honorable members, that can do online. But this was a good story to tell. Thank you very much.
Well, you just took the word right out of my mouth, Honorable Deputy Minister, to say thank you so much for this information. As the committee, we will congratulate the department where it does good work, and then we will have stressful discussions like this morning. So that is just the nature of the beast. So thank you so much for this. We really appreciate the work that is being done by the Central Drug Authority. I see that the chairpersons are still here. Thank you for the work that you are doing. We're looking forward to the comments and the answers to the questions that were raised by the honorable members. And of course, thank you to the department for the class of 2024. May we hear more of these innovations and technology advancements that you are using to give us information that is tangible, information that we can talk about, information that we can improve on, and so on and so forth. And as you said, policy development can come out of the information that you have presented to us. So we are very grateful as a committee. I wish to thank the committee for having set the whole morning and afternoon. I believe that the meeting has given us the information that we can use going forward. I want to thank each and every person that is here, all the teams, all the leaders of the entities, Mr. Buthelezi. It doesn't sit right for me to say he's from where he is, but thank you so much for coming through, and all the teams that have come here today, and obviously the people that this work cannot happen without, which is the team in the committee itself that is providing us with the support that we need. And we had an agenda that was approved, adopted, and seconded that talked about the internal business. I want to apologize to the members of this committee by saying that all of us need to be in the dome in no time. So I would like to please defer the internal business to the next meeting because of the situation that we are in. With those very few words, keep up the good work, and God bless you. Thank you so much.